Let me tell you. Girl, you my little boo thing, so I don't give a hoot what you do. Say, girl, I know you a little too tame. I'll be shooting that shot like 2K, girl, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know. Put a little gold in the teeth and the fit good, so I took the doors out the deep. Okay, I see a brother holding your seat, no beef, but I'm trying to get to know you at least. Don't take my talking to your own. I can keep it chill like the Soviet blunt. I'ma keep it real when your man long gone. If you're looking for a friend, then you got the wrong song. Baby girl, what's good? What's with ya? If you book tonight, that's fiction. I'm outside, no pictures. You want me? Go figure. To the back, to the front. You a 10, baby girl, but I'm the one. Hey, to the back, to the front. You a 10, baby girl, but I'm the one. You my little boo thing, so I don't give a hoot what you do. Say, girl, I know you a little too tame. I'll be shooting that shot like 2K, girl, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know. Hey, girl, you got me. I'm singing. It's like, oh, you got the best of my love. Oh, you got the best of my you got the best of my love. Oh, and that dress on white. You my little boo thing, so I don't give a hoot what you do. Say, girl, I know you a little too tame. I'll be shooting that shot like 2K, girl, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know. Tell 'em I'm next. Tell 'em you find a little something too fresh, I know.
Our ever-loving Father, the core of every reason, the source of truth. You who made the earth and the heavens are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. We are truly grateful for this opportunity to gather together as a community despite the challenges we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the limited time we have. They can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord. Amen.
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now and the victory is near. Excellence is our only standard to outshine the rest. With a great mind and compassionate heart. View Academy. We shout with pride and heads up high as victors our dreams shall soar to the sky. The greatest will be the best we can be. Soar to the sky. We learn that if you want to top rock, if you got it, soar to the sky.
All right, good day to everyone. Welcome back to our international test preparation. This is pharmacology class, right? Hello, can you hear me loud and clear po? Loud and clear ba si sir? Give me a thumbs up sign. You can hear me. Yes? All right. So I hope that you are reminded by our guidelines, okay, before we start our class. Ano po? So welcome to those who are part of the new cycle. Diba? May mga new cycle ba ngayon? And I hope that this would be another learning session with you guys. I think I have 4 days or 4 sessions with you, Nax. 4 sessions tayo ng body pharmacology. And I hope that you will be learning a lot from our discussion. So once again, my name is Jeremy Cabañas. And before we start, I'd like to invite everybody for a short prayer. And let's be in the presence of God as we pray. Heavenly loving Father, how great thou art, dear God. You are the source of knowledge and wisdom and the fountain of life. We bring back all the honor, praises, and glory to you. Dear Father, as we start our discussion, I pray that these nurses would be able to digest and absorb our information for today. Help them to remember all the things that we will be discussing. Give them a sharp memory, give them critical thinking ability and the nursing judgment. Help them, dear Father, also in their endeavors and undertakings. May you provide us the double portion of your Holy Spirit and your holy angels to watch and guide over us, that we will be free from any harms and dangers. I pray, dear Father, that you will also bless the works of our hands, our livelihood, and our families that we represent, and you will make us an instrument in the furtherance of your work. May you also forgive us for all the sins that we have committed against you. And we are asking all of these things through the precious name of our Lord and Savior, Jesus Christ. And those who believe may say amen. Amen and amen. All right, sige po. So I hope that everybody is now ready. Let me just pull out my presentation for you guys. How's everybody? Kumusta po? Is this a new cycle or the unlimited group, or is a combination of the unlimited and the new cycle, right? Tama? O, kumusta naman ang inyong review? All right. How is it? Kumusta? Ano po ang nangyayari na sa inyo? Nagpa-practice exams ba? Yes? Okay naman? Nakaka-follow naman sa ating mga lectures? Are you able to follow the discussion? Ayan. And are you learning a lot? Sige, just let me know lang ano. So, by the way, our discussion today would be, okay, I'd like it to be interactive. So that is why if I do have questions, you can also send your reply through your chat messages. And if you do have questions, please don't hesitate to raise your hands. And okay, I will be giving you a chance to also open your microphones if you have clarification with regards to our topic for today. Ano, so magsa-start muna tayo with the basic pharmacology. Ano, doon muna tayo mag-start ano so that everybody will have an idea, okay, bago tayo magpunta sa clinical. Clinical are those drugs that is affecting different systems of the body. So I'll be starting with the introduction in our pharmacology. Okay. Hold on, hindi ko lang makita yung presentation ko, ano? Ayan, sa sobrang dami ko ng slides ni sir. Alright, I think it's here. Okay, sige po. Alright, so I'll be presenting my slides. I hope that everything is okay visible from your end. All right, so let's start with your pharmacology. All right, sige po, ready na ba? So what would be our goal? Goal muna tayo and objective. Our objective is for you to use the nursing process while you are administering medication. So first and foremost, ang didiscuss natin is the introduction to pharmacology followed by the principles of medication administration. Kasi di ba, one of the tasks and responsibilities of RNs are to administer medications for our clients. Sige, so doon tayo magfo-focus today. So again, it's more of an introduction to pharmacology. Then we will be applying the basics, okay, how to administer the medications, the principles, and of course we will be combining the nursing process from assessment down to evaluation. So once again, I'm your lecturer for today. My name is Jeremy Cabañas. Ayan po. So again, we are a 12-hour difference time. Ano po? So in your time, it's 7:10 in the evening in the Philippine time, ano? But here with me in the Eastern Standardized Time dito po sa US, I am okay having 7:10 a.m. So 12-hour difference lang po tayo. So I hope everybody is now ready by hitting the thumbs up button. Patingin nga si sir ng inyong mga thumbs up button. Can everybody understand Tagalog and English language? Everybody can understand both Tagalog and English language. Do we have any foreigners right now in this congregation? Do we have foreigners? Wala naman pong... Alam ko si Sir Justin. Sir Justin, nandyan ka, no? Foreigner. Ayan. Foreigner daw si Sir Justin. Sige. Anyway, okay, so let's start our discussion for today. And okay, we'll be discussing about the basics of pharmacology. Sige po. So let's start with the definition of drug. Okay, so pag sinabi kasi natin pharma, pharma means ology. It's the study of drug. And what is a drug? Okay, let's define. Now, you have to remember the drugs are chemicals that when it is absorbed in the body, it produces a specific response. Right? It produces a specific response. So later on, I'll be discussing about, okay, what would be the specific response, okay, of your drug. So again, it's a form of chemicals that when it is absorbed, it produces a specific response. Now, you have to remember that the following are the sources of your drugs. It comes from the following. Ano? Sorry, medyo maliit yung slide ni sir, no? So the sources, it comes from your plants, okay, animal products. So say for example, ano, meron tayong mga drugs that is coming from our herbs. All right, from the root of a tree, from the bark of a tree, from the leaf of a tree, and then they will just be what transforming this chemical into okay substances so that it will become a drug. So it could be coming from plants. So one of the best example for this is digoxin. Okay, digoxin is one of the medication that's coming from the bark of a tree. So it could come from plants. Next, number 2. Okay, drugs can come from animal products. So what would be the best example? Best example is insulin. Tama? Insulin. Now, insulin can come from beef sources, from pork sources. So it comes from an animal source, diba? Ano pa aside from your insulin? Immunoglobulin. Diba? Yung mga antibodies and immunoglobulin that is being administered, it may also come from animal products. Yung mga serum, diba? That can also come from animal products. And, okay, it could also come from inorganic compounds and finally from synthetic sources. Synthetic are most likely chemical sources. Now, your drug actions, okay, these are the specific responses, could be either agonist or antagonist. Okay, so what would be the difference between these two terms? When I talk about agonist, the drugs that produces effects similar to those produced by naturally occurring hormones, neurotransmitters, and other substances. What does it mean? It means to say that, okay, ano ang pinaka-important na keyword natin sa agonist? Agonistic drugs, sabi dito, okay, it binds with the specific receptor. So say for example, these are what we call the drugs or the hormones. These are the specific receptors. So basically, they will bind at the site. Basically, they will bind at the site. So definitely, okay, it's the opposite of your antagonist. But when we talk about antagonists, these are the drugs that inhibit cell function by occupying the receptor site. So what does it do? It usually blocks. So when I talk about antagonists, the other term that you can use would be inhibitors or blockers. Inhibitors or blockers. So when you heard the word inhibitors or blockers, you know for a fact that this drug may be able to, okay, may be able to antagonize or occupy the cell receptor. So pag inoccupy niya yung cell receptor, then definitely the binding ability of the drug would not be able to occur. Alright, so okay, pag sinabi kong agonist, okay, definitely ang gamitin mong keyword dyan, it potentiates. Okay, it potentiates a specific hormones, neurotransmitters, substances onto the drug receptor. So that's what we call your potentiates. Antagonist, ang gagamitin mong term dyan, inhibits or blocks. Inhibits, okay, or blocks. Yan ang gagamitin mong term dyan. Alright, so madaling tandaan yan. Okay, it could be either agonistic action or, okay, antagonistic actions. Alright, so those are the two specific drug actions. These are the specific responses. Alright, so that's all about your medications or your drugs. Questions on the introduction on the first part? And questions po? None? So far, so good? Alright, sige po. So let's proceed now with the next part of our discussion. Okay, so pharmacodynamics versus pharmacokinetics. So i-review nga ulit natin. Let's review. Okay, now when we talk about pharmacology, ano nga po ba ang pharmacology? Guys, magkaiba yung pharmacology between pharmacy ha. Okay, when we talk about pharmacology, this is the study, sabi natin, study of drugs. Okay, or medications. So that's what we call your pharmacology. Okay. Now, what would be the difference between pharmacy? Pharmacy is a science that deals with, okay, the dispensing of drugs or medication. All right. So I repeat, the difference is pharmacology is a study, okay, of drugs or medications. But when we talk about pharmacy, this is the science and art of dispensing, okay, of drugs or medications. Now, what do you mean by a drug? Ano ba yung tinatawag nating drugs or medicine? Ano nga sabi natin? Review. Drugs or medicines are usually substances that when it's absorbed, it what produces a specific response to the body. What are those specific responses or action? It could be either review, could be either number one, agonist. Ano nga ang gagamitin nating term? It potentiates the effect of what? Of specific hormones, neurotransmitter, or specific, okay, substances or chemicals. So, ibig sabihin, anong ginagawa niya pag sinabi kong potentiates? It usually binds. It usually binds at the site, at the receptor site. Now, when we talk about your number two, we have your antagonist. Ano nga ang ibang term na ginagamit natin sa antagonist? It's either your blockers or inhibitors. So, ano nga ginagamit nating term? The word are to block or to inhibit. It usually inhibit the effect of a specific hormones, neurotransmitter, or substances. So, anong ginagawa niya? It usually occupy the receptor sites. It usually occupies the receptor sites. So anong nangyayari when they occupy the receptor sites? Binding would not occur. So ang pinakamahalaga dyan sa agonist, dapat nagbabind ang substances. Sa antagonist, dahil meron tayong tinatawag na occupying of the receptor sites, it will not be able to bind. Thus, okay, the action of specific substances will not occur. All right. So those are the two responses or actions. And what are the usual sources? Review natin. Saan daw galing ang ating drugs? Okay, it may come from different sources. Select all that apply from your plants, from animals, from where? From inorganic compounds. Diba? Saan pa galing yan? It could be coming from your synthetic sources. Synthetic sources. And pakidagdag pa, nakalimutan ni Sir, human. Okay, human sources. Alright, so humans can also be a source of drugs. So say for example, nowadays when you hear the word Humalog, Humulin R, di ba? Narinig mo na yung mga ganun, Humulin N. So that may come from human. Insulin that may also come from human sources. Sir, ano po ang differences lang kapag ang mga serums natin, insulins are coming from humans, allergic reactions would not most likely occur as to compared with the animal sources. So mas naiiwasan ang mga allergic or anaphylactic reaction. Alright, so those are the important sources. So tatandaan ang difference sa pharmacology versus pharmacy. Questions? Wala. Okay, na-expound ni Sir ng mabuti. Yes, bigyan ako ng thumbs up sign. Maliwanag tayo dito. So let's proceed now with your two important, okay, terms. Okay, so the difference between pharmacodynamics versus pharmacokinetics. So first, let's talk about pharmacodynamics. In pharmacodynamics, it means to say that what drug does to the body. what drug does to the body. So when we talk about your pharmacodynamics, we are referring to specific actions of the drug. I am talking about the specific actions of the drug. What drugs does to the body. So that's what we call the effects. Pharmacodynamics, what drug does to the body or the effects, okay, of drugs to the body. So what do you think are the effects of drugs in the body? So we have different forms of effects. Number one, we have your primary effect. Okay, so what do you mean by a primary effect? When I talk about primary effect, in other books, they call it the desired effect or the therapeutic effect of the drug. I repeat, anong ibang tawag sa primary effect? It is what we call your desired effect or the therapeutic effect of the drug. So when I talk about primary effect, it is the intended effect. Usually, it's intended effect of the drug. So ibang term na ginagamit nga uli, huwag kakalimutan, this is also known as the desired or the therapeutic effect. So I'll be giving you an example of the desired and the therapeutic effect of the drug. So say for example, you are administering a medication known as ibuprofen Advil. Very common, di ba? Ibuprofen, Advil. Ano nga po ba ang classification ni ibuprofen and Advil? Ibuprofen, Advil is a form of an NSAID. So what do you mean by an NSAID? It is a non-steroidal anti-inflammatory drugs or also known as prostaglandin inhibitors. Also known as prostaglandin inhibitor. So saan siya ibigay? Ano ang usually effect ng ibuprofen? Ibuprofen is an analgesic and at the same time, this is antipyretic and at the same time, this is considered also as anti-inflammatory drug. Okay, it is called an analgesic. Bakit siya analgesic? Because it inhibits prostaglandin. You have to remember the pain, diba? Pain occurs because of the presence of prostaglandin. So whenever we block the prostaglandin, what will happen? It can relieve the pain. So anong kanyang desired effect? Desired effect, primary effect niya, analgesic, it relieves the pain. All right, next, second, it can also be as an antipyretic. So dahil sinabi nating antipyretic siya, what does it do? It reduces, body temperature. It reduces body temperature. So from having a fever, it converts fever into a normal temperature. And finally, it is also an anti-inflammatory drug. So dahil siya ay anti-inflammatory, what does it do? It reduces swelling or inflammation. This is reducing swelling or inflammation. So anong tawag natin doon sa ginawang action ni ibuprofen? These are what we call the primary, the intended, the desired, or the therapeutic effect of the drug. Questions regarding the primary effect? Wala? Sigurado naintindihan? Good job. Okay, naintindihan yung primary effect. Now, let's talk about the secondary effect of the drug. Sige, punta tayo kay secondary. Now, what do you mean by a secondary effect of the drug? So, pag sinabi naman nating secondary effect, this is usually unintended. Secondary effect usually are unintended. So, I'll be giving you an example, of secondary effect. It can be classified into either side effect, diba? It could be either classified as side effect of the drug versus it could also be your, adverse effect of the drug. Sige po, let's differentiate between these two terms, side effect versus the adverse effect of the drug. So what do you think would be the difference? Both of them are unintended. Unintended talaga siya, but side effect are usually expected and usually non-life-threatening. Okay, tatanda na, usually not life-threatening. You have to remember that, okay? It is usually expected and usually non-life-threatening. So that's what we call the side effect. Now, when we talk about your adverse effect are usually unexpected, unintended, so unexpected, and usually fatal. And usually fatal in nature. So, ibig sabihin, when you were asked to prioritize, when you see manifestations of a client who are, being administered with medications, you will always prioritize the client with an unexpected response to the drug. And that's what we call the adverse effect. So, sa prioritization, don't forget that adverse effect should be one of your priority. All right, sige po. So, I'll be giving you an example between, the side effect, versus an adverse effect of the drug. So, punta ulit tayo, ibuprofen Advil. Okay, let's have the example of ibuprofen Advil. Now, what do you think would be the side effects? Since this is a prostaglandin inhibitor, this drug can cause GI upset. Diba? Nakakasakit ng tiyan. It can cause abdominal pain, GI upset. Why? Because prostaglandin usually, are naturally occurring on the lining of the stomach. So you have to remember that prostaglandin protects. It has a cytoprotective effect. Ano bang ibig sabihin ng cytoprotective effect? Cyto means cell, protective means it protects. So it protects the lining of the GI tract. Ulitin ko, anong ginagawa ni prostaglandin? Naturally, aside from it produces pain, there is a specific receptor in our stomach. We call it as the PGE2. Naalala si PGE2? Si PGE2, siya yung nagpo-protect ng lining ng stomach. Now, sabi dito, prostaglandin inhibitor, you block the prostaglandin. So all of the receptors of the prostaglandin are affected. So kasama dyan si prostaglandin E2 that it can be found in the stomach lining. So what does it do? When it blocks the effect of PGE2, wala kang cytoprotection or protection of the mucosa of the stomach. That is why it can cause GI upset. Diba? So that's what we call the side effect of the drug. This is expected, but usually not life-threatening. So ano lamang ang gagawin mo dito kapag meron ka side effect? Ano ang nursing intervention mo lang pag may side effect? Nursing intervention for side effect is what? You just need to provide health teaching. So whenever there is a side effect related to the drug, you just need to provide health teaching. So dahil may GA upset, what do you think would be the best teaching? When is the best schedule to take the drug? Okay, very good. It should be taken after meals or with meals, with food. Very good. Ayun, ganun lang. Pag side effect, turuan mo lang siya, teach the client about how to relieve these side effects because these are usually expected and bound to occur. All right, so let's talk about now your adverse effect. Now, what is adverse effect again? This is unexpected and usually fatal or life-threatening. So dahil life-threatening siya, example po, so balik tayo kay ibuprofen Advil. One of the example would be your peptic ulcer disease, PUD. Ano pa ang adverse effect niya? One of the adverse effect also is anaphylaxis. Some of the clients can have allergies related to Advil or ibuprofen, right? So definitely, what do you think would be your nursing intervention since these are life-threatening? When you see the adverse effect, what should you do? Immediately, you need to notify HCP. Immediately, what should you do? Notify HCP. Kailangan sabihin mo sa doctor so that the necessary medical intervention can be done. So definitely, that's for adverse effect. Bakit ino-notify? Kasi nga, life-threatening. So pag ang tanong sa'yo, which among the following clients who are receiving drugs, that should you follow up? Pag nakalagay yung mga word na yun, follow up. Which one should be, requiring to be notified the HCP? So you have to select those patients with signs and symptoms of an adverse effect of the drug. So that's all about your secondary effect questions. May tanong tayo between side effect and adverse effect. None. So far, so good. Pwede screenshot po ito. Yes, naiintindihan very clear ang discussion naman natin. So let's talk about the third. Okay. The third effect. Okay, another effect of the drug, number 3, aside from primary, secondary, we have also what we call your teratogenic effect. Teratogenic effect. All right. Now, what do you mean by a teratogenic effect? Ano ba yung tinatawag na teratogenic effect? It means to say that it can cause, these are the drugs that may cause fetal harm or injury. These are the drugs that may cause fetal harm or injury. I'll be referring to my slides. I think meron ako niyan dito. Ayan. So these are the pregnancy safety categories, ano? So punta muna tayo dito sa safety categories. So punta ka muna sa safety categories before I discuss your teratogenic effect. Now, when we talk about your pregnancy category A, ibig sabihin nito, these are the safest. Okay, these are the safest. Okay, among all of the categories, these are the safest. So anong ibig sabihin ng safest? There is no known adverse effect or adverse reaction that has been found in both animal and human studies. So talagang these drugs are usually used because it's considered as safe. Now, pag sinabi natin pag sinabi natin pregnancy category, okay, B, there is a risk. But the risk outweigh the benefits. There is a risk that has been found. Okay, risk has been found for both animals and humans, but the risk will outweigh the benefit. May risk siya, pero mas maganda pa rin yung risk as compared, mas maganda pa rin yung benefit niya. The benefit outweighs the risk. All right, so that's what we call your pregnancy category B. That's pregnancy category C, not enough research studies. So there are not enough research, investigation with regard to the drug, whether it has an adverse reactions. And category D, it means to say that adverse reactions have been found in both animals and human studies. So may adverse reaction. But when we talk about category X, this is what we call your teratogenic drugs. Teratogenic drugs. So pag sinabi ko ulit na teratogen, ano ang ibig sabihin ng teratogen? It can cause fetal harm or injury. So these are the pregnancy categories. Okay? Questions, may tanong. Sige, review natin. Category A, sa tandaan, these are the safest among all of the drugs for pregnancies. Okay, category B, there is a risk, but you have to remember that the benefits always outweighs the risk. Category C, there are not enough research studies or investigations that have been made in both animal and humans. And letter D, there is an adverse reactions that is found in both animal and humans. And if it's a pregnancy category X, these are usually a no-no. It should not be administered to pregnant clients. So they are called your teratogens. All right, are we clear? Yes, paki-screenshot po ito ha para naalala ito. Alright, sige, punta po tayo with regards to your application to the actual exam. Application tayo sa NCLEX, ano? Now, when we talk about your drugs that can be teratogen, what are the examples? Examples of the drugs that can cause fetal harm, don't forget your mnemonic terato. Guys, favorite ito ng ng actual question. So bakit nila ito favorite? Because we are dealing with the safety of your pregnant mothers. So don't give these drugs because these drugs are considered, okay, teratogenic. It can cause fetal harm or injury. So the first one is your thalidomide. Now, what would be the category of thalidomide? Thalidomide has been used widely before as a psychotropic drug. Sa ginagamit, it's a psychotropic drug. But nowadays, it has banned for its use. Bakit binan siya? Ano ang pwedeng maging effect ni thalidomide kay baby? The research found out that it can cause amelia and phocomelia. Okay, alam ba si amelia and phocomelia? Okay, have you seen children, okay, without limbs? Nakakita ka na walang extremities. That's what we call your amelia and phocomelia. Right? Okay, so that's what we call your thalidomide. So thalidomide, okay, are psychotropic drugs that should not be given. Bawal na bawal daw si thalidomide. Okay, next, let's talk about your letter E. What else? We should not administer epileptic drugs. So what are these epileptic drugs? These are also known as anticonvulsants. So these are the drugs that is used to prevent seizure. So an example, phenytoin, diba? Bawal yan. Valproic acid, levetiracetam, yan, ano pa? Your lamotrigine, carbamazepine, all of which are considered as anticonvulsant that can prevent seizure, but should not be given to a pregnant mothers. These can cause fatal harm or injury. So if you would be asked, among all of the anticonvulsant, paano kaya pag ang patient mo at risk for seizure, say for example, in severe preeclampsia, what do you think would be the safest among all anticonvulsants? What would be your answer? Alin kaya ang pwede sabutis? Your answer is magnesium sulfate. Huwag kakalimutan yan, mag sulfate. Ano nga ulit ang classification ni mag sulfate? Is it antihypertensive or anticonvulsant? Antihypertensive or anticonvulsant si mag sulfate. This is considered as anticonvulsant. Wala magsasagot ng antihypertensive ha. Wala magsasagot ng antihypertensive ha. Okay, please, please, please. Yung pagbaba ng BP due to the administration of magnesium sulfate is just its secondary effect. Secondary effect lang, side effect lang yun. But generally, okay, the major purpose why we give magnesium sulfate is to prevent seizure from occurring. Are you with me? Yes, nagkakaintindihan tayo ha. Sigurado, clear ang discussion. So the only anticonvulsant that can be administered is mag sulfate. Huwag kakalimutan yan na pag nag-coaching tayo. So, dapat alam yan. Next, letter R. R stands for your retinoids. So, what are your retinoids? Retinoids are also known as your vitamin A derivatives. And ito naririnig, these are also for anti-acne drug. Ito yung mga ina-administer sa derma. Naalala? Yung pag maraming pimples, may acne vulgaris. Alala mo? Cystic acne vulgaris. Talagang severe yung kanyang acne vulgaris. So definitely, anong ina-administer sa kanya? Binibigyan siya ng retinoids. It could be either orally. We call it as your Accutane. Narinig na si Accutane. Accutane or also known as isotretinoin. So pag narinig mo si Accutane, pampaganda. Nax. Oo, yan. Accutane or, okay, Accutane or also known as isotretinoin. Ayan. Nagganyan ako before. Oh, Nax. Oo, nagganyan ako before kasi nagkaroon ako ng breakout. I had a break. When I was in the UAE, hindi ko alam, nag-breakout talaga si sir. Stress ako ng bongga doon. And then, I consulted the dermatology. Okay, good thing. Okay. And he prescribed me with this drug. O talaga nakaka-glow siya. Promise. Dito ko nakita yung glow ko talaga. Promise. At tas hindi na siya bumalik, guys. Hindi na siya bumalik. Ah, wow, sana all. Ayan, glass. Ay, kaya pala may fog. Tagal na yun. Matagal na yun. Nasa UAP ako. 2 years ago na yun. Makabili nga. Ma'am Edna, hindi pwede, hindi yan nabibili basta-basta. Kailangan supervise yan ng doctor. Bakit? Kasi this drug, one of the side effect of this drug is it can cause hyperlipidemia. It can also cause hepatotoxicity. Ayun lang. Hyperlipidemia and hepatotoxicity. Kaya hindi siya pwedeng, kailangan supervised. And then it can also cause, okay, photosensitivity. Sign na ba na magpa-IV drip? Tiis ganda, wow. Sir Justin, minsan tiis lang, di ba? Tiis lang, wala namang ganda eh. Asan be? So ito yung mga pampaganda. Now, meron ding topical na binibigay, no? One of the topical is called your, ano man tawag sa topical na to? Retinoids nga, retinoids. Siguro naririnig mo si retinoic acid. Ano pa, aside from retinoic acid, adapalene. Narinig mo na si adapalene? Retinoic acid, adapalene. Ano pa? Retinol, yung pinakamababa na dose, retinol. Yung nilalagay sa mukha, right? Okay, retinol. Kung narinig mo yan, ayan, the ordinary retinoid. Yan, okay. Even that type of drug, even if it's topical, they found out that it can be absorbed by the woman's body. Thus, what will happen? It can also cause fatal harm or injury. So, lahat ng klase, whether that is an oral isotretinoin or a topical retinoids, it should be avoided by the pregnant mothers. Are we clear? So bawal ha kapag buntis ha, bawal yung mga retinoids ha. Very clear. Kaya nga one basic ano nila, basic nursing interventions but before the prescription, no, they send the client to check for a pregnancy exam. And we usually ask the mothers to sign a waiver form. Pinapasign ng waiver form yung mga babae na hindi talaga siya buntis. Kasi talagang siya ay considered as, okay, a drug that is considered teratogen. So, clear na tayo sa retinoids, ha? Sir, 9 months ka palang walang skin. Okay ka lang yung regular skincare niya. Pwede niyang i-continue yung regular skincare. Just the regular skincare without the retinoids. Ayun. Next, let's talk about your letter A. Letter A stands for your drugs that are considered as antihypertensives. Antihypertensive. Best example na talagang considered as teratogen are your ACE inhibitors. So pag nakita mo to ha, ito yung mga drugs na nagtatapos sa favorite nila to. So tinanong ka, what do you think would be the drugs that is safest during pregnancy? Antihypertensive that is safest during pregnancy. What would be your answer? Sige nga. Sagot, sagot, sagot. Ano daw drug ang considered as safest among all of the following? The answer would be your hydralazine. Hydralazine, apresoline. Okay, ito yung kanyang brand name. Hydralazine, apresoline. So, i-check mo yan ha. Ito lamang po ang pwedeng ibigay. Okay, si hydralazine, apresoline. You have to remember that, okay, your drug, which is considered as your ACE inhibitors are considered as teratogen. Okay, so clear tayo dito ha. So ano lamang po ang pinaka-safest? Ang pinaka-safest na ibibigay mo lang hydralazine. Okay, brand name. Very common kasi dito brand name ang ginagamit nila, Presolin. So i-check mo yan. Ito lamang ang pwede nating ibigay. Alright, so especially if the mother is suffering from a gestational hypertension. Alright, sige po. So clear tayo. Next. Let's talk about your letter T. Okay, letter T stands for under your terato, okay, letter T stands for, ano yung letter T na to? Antihypertensives. Letter T, tetracycline. Yun. Tetracycline, this is a form of antibiotic. Good job, Kyla. Tetracycline. Now, what would be its effect on the babies? Bakit kaya bawal si tetracycline? Particularly, tetracycline can cause hyperbilirubinemia. Okay, anong effect daw niya? It can cause hyperbilirubinemia. So what do you mean by hyperbilirubinemia? Emia means in the blood. Hyper means increasing. Ano yung nag-i-increase sa blood? Increasing ang bilirubin ni baby sa blood. And when the bilirubin of the baby is increased into the blood, what would happen to the baby? Ano mangyayari kay baby? Of course, it can cross the blood-brain barrier. So when it crosses the blood-brain barrier, it causes a condition known as starting with letter K. Starting with letter K. Pag mataas ang bilirubin ng baby, ano mangyayari kay baby starting with letter K? What would be the complication? Anyone? Letter K stands for your answer, kernicterus. Naalala? Kernicterus. Yes. Guys, naalala kernicterus? Hello. Hi. Naalala ang kernicterus? This is usually a complication of high level of bilirubin among babies. So anong nangyayari kay bilirubin? It can cross the blood-brain barrier. When it crosses the blood-brain barrier, the baby will suffer from kernicterus or also known as cognitively challenged child. Ayun. Magiging bubita yung bata, di ba? Sorry for the term ha, pero yun po talaga yun, di ba? Kernicterus kasi nga na-damage na ang kanyang brain. Yun, brain damage may occur. So that's why the child can become cognitively challenged. So if you would be asked, among all antibiotics, which one do you think is the safest among all? What would be your answer? Sir Justin, wala ka naman yan. Grabe ka naman. Hindi ka naman bubito. Grabe ka. All right, so what do you think would be the safest? Okay, safest among all. Very good, Kyla. The correct answer is penicillin. Ayan. The correct answer is penicillin. Ayun, yun yung mga pronunciation. Natutuwa sila sa mga pronunciation namin dito. Tanong ko, do you have penicillin there? Do you have guayapenicin? Do you have rubitocin? Mali daw, hindi daw yon. Pag sinabing penicillin, pang Pilipino yon, it should be penicillin. Robitussin, no? The stress should be placed on the second syllable of each word. Ayan, so penicillin. So yan po yung pronunciation niya. So this is the safest among all. So yung mga drugs na nagtatapos sa silin. Ano ba yung mga drugs na nagtatapos sa silin? Yan, amoxicillin. Diba? O yun, mga silin drugs yun. Ano pa? Amoxicillin. Basta anything that ends with silin. So they are considered as your penicillin derivatives. All right, so let's talk about your letter O. Letter O. Okay, O stands for avoid giving the following, such as first, we have your oral hypoglycemic agent, OHA. Now, you have to remember that OHA are the treatment for what? For diabetes mellitus. So pag tinanong ka, ano kaya ang safest? O safest tayo. Kung hindi pwede ang OHA, ano kaya ang pinaka-safest during pregnancy? Answer, insulin. So the safest, okay, insulin. So we do not give OHA. Next, another one. We do not also give another letter O. O stands for, okay, O stands for oral contraceptive pills. Ayun. Bakit? Ano ba ang content ni oral contraceptive pills? It contains estrogen. Anong naalala sa ating pregnancy? Pregnancy hormone, ano nga ba yung nagme-maintain ng pregnancy? What hormone maintains the pregnancy? Answer. Ano ba yung hormone na nagme-maintain ng pregnancy? Answer, pregnancy, letter P, progesterone. Diba? Pregnancy, letter P, progesterone. It maintains the pregnancy. Now, what would be the effect? Anong effect niya kay baby kapag nag-take ang mommy ng OCP? Since it contains estrogen, what would be its effect? Its effect is it can cause premature labor. Very good, Kyla. It can cause premature labor. So that would be the danger. So oral contraceptive pills are avoided. Plus another letter O, we do not give any form of opioids. Letter O stands for opioids. Opioids are your narcos. Okay, mga narcs. Okay, narcotics. Opioids or narcs. So these are usually, okay, your opioids or narcs kasi anong pwedeng mangyari kay baby? What would be its effect in the baby? The baby will suffer from neonatal abstinence syndrome. Uy, favorite ito sa actual NCLEX. What are the signs and symptoms of neonatal abstinence syndrome? Ayan, so dapat alam na alam mo yung neonatal abstinence syndrome. Okay, anong naalala mo dyan? It's a form of withdrawal. Good job, Kyla. It's a form of withdrawal. So since the mother is receiving high doses of opioids during pregnancy, so it can allow the passage, okay, it can allow, okay, the transfer of the opioid substances through the placenta. So ibig sabihin nakaka-cross ito ng placenta. So when it crosses the placenta, if the mother is addicted to the substance, most likely the baby is also addicted. So dahil ang baby addicted yan, and then when the mother gives birth, nag-give birth ng mommy, wala nang source ang baby ngayon kasi wala na si placenta, wala nang source ng narcs or ng opioids. So what will happen? The baby will start to develop withdrawal symptoms. Ayun. So that's also known as your neonatal abstinence syndrome. Guys, paki-research mo ito ha. Yung signs and symptoms, select all that apply, lumalabas yun sa exam. What are the usual manifestations of a baby with a neonatal abstinence syndrome? Alright, so very clear tayo. So mothers should not use recreational, even recreational substances, opioids, yung mga heroin, yan, heroin, morphine, hydrocodone, oxycodone, nalbuphine, yan, lahat ng mga yan, methadone, should not be used by the mother because of the risk of these type of condition. Alright, so clear tayo doon. Next, let's talk about your double use. Last but not the least, it's for warfarin. Warfarin administration. So warfarin is an anticoagulant. So pag tinanong, paano pag sir ang mother mayroong DVT? What do you think is the safest among all types of anticoagulants? Anong sagot mo? Safest during pregnancy is heparin. Tatandaan ha, the safest during pregnancy is heparin. Good job. Bawal na bawal ang warfarin kay buntis. Alright, so definitely, those are the drugs that we need to take note which are considered as teratogen. So we call it as your mnemonic terato. Questions? May tanong? May tanong tayo dito sa mnemonic natin? Wala. Pero bigyan si sir ng thumbs up side kung naintindihan ng teratogenic effect. All right, so let's talk about the fourth effect of the drug. Okay, the fourth effect of the drug is called your toxic effect. A toxic effect tayo. Now, pag sinabi nating toxic effect, okay, it means to say that it can result into the long-term use. Long-term use of drugs or medication. So if the patient is chronically taking the medication, so if it's a long-term use of the drugs or medication, what would be its result? Its result is tissue damage. Its result would be tissue damage. And there are certain types of drugs that can be damaging to specific tissues. So let's take examples of toxic effect. Toxic effects, example, number one. Okay, drugs, okay, can cause neurotoxicity. So pag sinabi kong neurotoxicity, what does it, okay, damages? It can affect both the brain and the nerves. It can affect the brain and the nerves. Okay, common signs and symptoms if the brain is affected. If the brain is affected, it can result into slurred speech, ataxia. It can also cause, okay, slurred speech, ataxia, and tremors. Okay, coarse head tremors. Yan. So pag nakita mo tong mga to ha, these are manifestations of, okay, neurotoxicity or damage the brain tissue. Yan. So there are certain drugs that when taken at a higher, okay, doses, okay, it can result into slurring speech, ataxia, and coarse head tremors. Pabalik po, sir. Ayan, binigyan na kayo ni Reese ng kanang screenshot. Ayan. Sorry. Pwede nating mabalikan yan later. Okay, sige po. So nerves naman tayo. So there could be, okay, drugs that can damage different nerves in the body. So say for example, it can damage which nerve? Peripheral nerves. Okay, may mga drugs daw that can damage peripheral nerves. So what will be its effect? It can cause peripheral neuropathy or neuritis. Peripheral neuropathy or neuritis. Okay, naalala mo tong mga drugs na to, ma'am, dadaanan natin ito as we go along with our clinical pharmacology. So there are drugs that can result damage to our peripheral nerves. What else? Cranial nerves. Say for example, it can also damage our optic nerve. So there are drugs that can be damaging to optic nerve. Anong pwedeng mangyari kapag optic nerve damage? Optic neuritis. Yan, optic neuritis would be its result. Yan, so it can damage also the optic nerve. Meron din naman damage to our, okay, acoustic nerve. Diba? Acoustic nerve. So if it's acoustic nerve damage, ang tawag mo dito is ototoxicity. Ototoxicity, the first sign is tinnitus. And then hearing loss can also be its result. Ayan. So pag nakita mo ha, long-term use of this drug, can also cause ototoxicity. So acoustic nerve damage. So brain and nerves can be damaged. Ang tawag natin neurotoxic. Okay, next. What else? Aside from neurotoxic, some of the drugs can become cardiotoxic also. Ano naman yung cardiotoxicity? It can damage the heart. So when it damages the heart, some of these drugs can result into heart failure. Yan, heart failure. So dadaanan natin ano ba yung mga drugs na nagkakos ng heart failure. Alam ko, there are certain antipsychotic drug that can cause heart failure and chemotherapeutic drug that can cause heart failure. Next. What else? Prime cardiotoxicity, another one. So we have neurotoxicity. We have your peripheral nerves, optic nerve, acoustic nerve. Yes, cardiotoxicity. What else? It can be also nephro. A nephrotoxicity, it can damage our kidney. So long-term use of the drug can be damaging to the kidney. So how would you know that? Okay, there is damage to the kidneys. What are the typical manifestations whenever there is oliguria? Yan, and decreasing urine output, oliguria. Yan. Usually, yan ang makikita mo kapag may nephrotoxicity, decreasing urine output, and increasing BUN and creatinine. Very good. Increasing BUN and creatinine. Yan. So, yan ang hahanapin mo whenever there is nephrotoxicity. Next, we have also, kapag nephrotoxic ka, we need to monitor first itong mga BUN and crea before we administer the drug. There are also certain forms of drugs that can be hepatotoxic in nature. So it can damage the liver. So common findings if there is damage to the liver would be jaundice. Jaundice and increased AST, ALT. Increase AST, ALT. So if the drug is known to be hepatotoxic, ito yung lagi mong i-discuss ha. Ang health teaching mo lagi, avoid alcohol. If the drug is known to cause, okay, problems of the liver, then definitely we need to avoid alcohol. Ayan. Sige, clear tayo dyan, ha? Alright, sige. So, those are the drugs that can be hepatotoxic in nature. So, may mga nakalimutan pa ako. Wala, basta tatandaan ito, ha? These are what we call long-term use. It can only happen when a client is using the drugs for a longer period of time. So, it can become toxic in nature. Alright, so questions about the primary effect of the drug. None. So far, so good. The effects of the drug, the differences between your pharmacodynamics versus pharmacokinetics. So again, okay, these are the different effects. It could be primary, secondary, teratogenic, toxic effect, okay, of the drug. So any other concerns, clarifications? Wala po. Very clear in discussion ni sir. Bigyan ako ng thumbs up sign kung very clear. Ayan. Sige, thumbs up sign po tayo. Okay, we are still on the introduction part. Okay, next, let's talk about your another effect of the drug. So let's talk about your pharmacokinetics. Okay, balikan natin si pharmacokinetics. Now, when we talk about pharmacokinetics, it means to say that what the body does to the drug. What the body does to the drug. Okay, so therefore, okay, we call it as your pharmacokinetics. So from the word kinetics, it pertains to the movement of the drugs in the body. It pertains to the movement of the drugs towards the body. Sige po, isa-isahin natin ha. Ready na? So mag-discuss tayo about your pharmacokinetics. Okay. Pharmacokinetics. So what the body does to the drug. What the body does to the drug. Okay, or also known as movement of drug. Okay, movement of drug in the body. So what do you think would be the movement of drug in the body? So mnemonic, add me. Mnemonic, add me. So you have to remember it starts with absorption. It starts with absorption. So question, okay, how is drug is being absorbed? Absorption could take form in a different manner. So yung absorption ng drugs natin, di ba? So say for example, primarily GIT. For oral administration, the absorption site would be on the GI tract. Or sometimes, okay, it could be, okay, through mucous membranes. Diba? It can be absorbed through the mucous membranes on the eyes, ears, sublingual, diba? Or it can be absorbed through the skin in patch, diba? Patches, gel, yan. Pwede rin ma-absorb sa skin. What else? Aside from the skin, from the respiratory tract. Right? So these are the most common routes. It could be on the GIT through the mouth, okay, and then it will be absorbed, okay, through the GI tract. Can be absorbed through the mucous membranes, our skin, and respiratory tract. So those are the areas of our absorption. All right. Sige po. Now, if you would be asked, what do you think would be the type of route that is 100% bioavailable that does not require absorption at all? Ito yung mga ginagamit natin. Okay, when we talk about emergency. So if you would be asked, among all of the routes of drug administration, which one should you use for emergency purposes? Because it does not undergo absorption, because it's 100% bioavailable. So what would be your answer? Very good, Cristel and Reese. The answer would be IV administration. So sagot mo ha, IV. So kapag yan ay 100% bioavailable, does not require absorption at all, then definitely that's your IV. So that is why it's used for emergency. All right, next, let's talk about your distribution. Now, distribution occurs, okay, through the bloodstream. So, ma-absorb siya through the GI tract, mucous membrane, skin, respiratory tract, then it will be on the bloodstream. So that from the bloodstream, it will be distributed to the target tissues. It will be distributed to the target tissue. So when we talk about distribution, the drug will be absorbed through the bloodstream and then into the target tissues. Okay, next, let's talk about your letter M. Letter M stands for metabolism. Why? Because drugs has an end product. You have to remember, hindi lahat can be used, can be utilized, because this is a chemical. So whenever it's a chemical, okay, it should be metabolized. Diba? So anong ginagawa na process? The process is called your biotransformation. And biotransformation occurs where? Saan ba nangyayari ang biotransformation? It primarily occurs through the liver. So the biotransformation occurs in the liver. So that is why if the patient has a liver problem, we usually decrease the dose of the drug. 'Di ba? Pag may mga liver problem, ang ating ano diyan, ang ating nursing responsibility, we need to decrease the dose. We need to adjust kasi nga the liver is the organ that transforming the end product, or else toxicity can occur. So you have to remember that. So metabolism primarily occurs in the liver, and the process is called your biotransformation. So, sir, how about if the liver has decreased biotransformation biotransformation ability? So say for example, the patient has a decreased biotransformation ability, patient has a liver problem or a liver disorder, what can happen? There could be a risk of toxicity. So the drugs, diba? Or the end product of the drugs will increase, and that can result into toxicity. So, tandaan niya na. So, metabolism primarily occurs in the liver through biotransformation. Pag sinabi kong biotransformation, that is the conversion of the end product, okay, into an excretable form. Okay, last but not the least is your excretion. Okay, excretion. Now, question. How does excretion occurs? Excretion occurs through half-life. Tanda na, excretion occurs through the half-life of the drug. So, ibig sabihin, basically, guys, ano ibig sabihin ng half-life? Okay, pag sinabi nating half-life, immediately, the drug will not be excreted. Hindi ibig sabihin na nag-take ka ng drug, immediately, after a day or two, lalabas na kagad lahat ng end product of the drug. It's not like that. Because each of the drug has a specific half-life. So, ibig sabihin pala nito, unti-unti. So, it usually excretes the drug, okay? It usually excretes the drug, okay, slowly and gradually. Tatanda na, gradual lang ang pag-excrete through its half-life. Now, okay, tanong, saan po ito na-excrete first? Okay, through the kidneys. Excretion can occur through your kidneys and GUT. Kidneys, genitourinary tract. It can also be what? Okay, excreted through our GI tract. Kidneys, okay, or through the GI tract. Or sometimes in our mucous membranes. Can also be excreted through the mucous membrane and through our skin, through your perspiration. Diba? So, pwede rin through perspiration. So, definitely, okay, it can be excreted through the half-life. So, pag sinabi kong half-life, it is gradually and slowly being excreted into the body through the kidneys and genitourinary tract, GI tract, mucous membranes, and of the skin. So, basically, talagang naiipon talaga yung yung drugs natin sa body. So, that is why, okay, sabi natin, it's just being, okay, excreted gradually. Ayan. So that's what we call your ADME. So pharmacokinetics, that's the movement of the drug. So questions about your pharmacokinetics versus pharmacodynamics. Wala. Clear na clear tayo dito. Can I receive a thumbs up sign from everybody? Thumbs up sign po, kung very clear. Okay, so hindi ako magpo-proceed sa so very specific details nito. Kasi ang tatandaan mo dito yung important implications and significance in your nursing interventions in the health teaching. So doon tayo magfo-focus. Alright, sige po. So we're done with this. Okay, so let's talk about now your 10 rights of drug administration. So let's talk about your medication administration. Right? Now, guys, you have to remember that the priority, why do we need to know the 10 rights of drug administration, is the safety of our patient. So you have to remember priority, why do we need to take note the 10 rights of drug administration or the principles of drug administration? It's for the purpose of the safety of our client. So these are before, 5 lang talaga siya. Right med or drug, right dose, right patient, right time, and right route. 5 lang talaga yan before. Then dun sa book ni Fundamentals of Nursing ni Koshier, inad niya si right documentation. And then it becomes 10, diba? It becomes 10. Okay, kung babasahin mo naman si Potter and Perry, ang sabi naman niya, 10 rights na siya. So including your right client education, right to refuse by the client, there should be right assessment and the right evaluation. So let's take into consideration the following. So first, let's talk about the right medication. Sige, ready? Alright, so dito tayo sa right medication. Hello. Nawawala ang screen ni sir. Ayan, sige. So punta ako sa whiteboard natin. So the first right, 10 rights is your right medication. So number 1. So how would you know that? Okay, it's the right medication for your client. Okay, what should you assess? What should you check first? First, you check your HCP's order. Diba, i-check mo, punta ka dun sa order section. Okay, so say for example, yung chart. So punta ka sa chart, dun sa doctor's order. Kami kasi naka-electronic medical record. So electronic medical record, punta lang ako dun sa name ng patient. Tapos makikita ko dun sa order section ano yung mga list of drugs. So HCP's order, what else? It can also be found on the medication administration record or your MAR. So you can check it out, okay, your doctor's order and the MAR. Now, question, frequency of checking of the label of the drug. Frequency, how would you know if it's really the right medication for your client? So what would be the frequency of checking? The answer is it should be done 3 times for the patient safety para alam mo talaga na tama ang tama yung gamot na yan for your client. So check it for 3 times. So kailan yung 3 times? Number 1, okay, it should be checked, okay, first before preparation. We check the label during preparation. And then you check it again before administration. Before preparation, during preparation, and before administration. You have to take note that it should be the right drug for your client. Okay, question. How about, okay, you take note that the drug being ordered are contraindicated for the client's condition. So, example, nag-order ang doctor and something that is erroneous on the order, specifically on the specific drug. Okay, question, what should you do? What should you do if you note that the doctor's order is contraindicated and is erroneous for the client? So what should you do? Ayan, the correct answer is you need to notify your HCP. Very good. Notify mo, clarify ka. Okay lang bang magtanong? Okay lang, 'di ba? Ask. Oh, tanungin mo si HCP dun sa nag-order. Tandaan, walang masamang magtanong, 'di ba? Huwag kang mahihiyang magtanong. Ayun. So tanungin mo pala, guys. So that you would know that it's the right label of the drug. Oy, sana all may label, 'di ba? Sana all may label. So may tanong ako dito, sir, Epic din po ba sa US? Most of the hospitals are using Epic. Ayan, most of the hospitals, depende sa institution or hospital ang ginagamit nila na system, ano? Sa amin kasi, okay, I'm in the long-term and rehab. Sa rehab na facility, ginagamit namin point click. Ayan, point click. Depende sa vendor. May iba't ibang klase kasing vendor. Pero sa mga hospitals, yes, Epic is used for your medication administration. Sige, so don't forget to ask to clarify if you note that the drug is erroneous. Good job. Next, number 2. Second tayo, no? So aside from the right medication, you need to, okay, compute for the right dose. Okay, number 2, right dose naman tayo. How would you know that this is the right dose for your client? So anong gagawin mo para malaman mo it's the right dose? Okay, of course, check also the doctor's order. Check also the medication administration record. Plus, you have to perform dosage and calculation. Dosage and calculation. Ayan, so dapat marunong ka ng dosage and calculation. We'll be discussing that later on is separate session. So isa separate session natin ito, no? So how to compute for the for the doctor's order. So paano natin i-compute yung ating right dosage. All right, next, what else aside from the right dose? Okay, number 3. Be sure also that this is your right. Number 3, ano nga sabi natin? Right patient. So how would you know that it is for your right? The right drug is for your right patient. So paano mo malalaman? So you need to verify. Okay, for at least 2 identifiers. Don't forget, verify for at least 2 identifiers. So if you would be asked, what are the identifiers that we can use? Ano yung mga identifiers? Example, you can use the full name of the client, first and last name. Example, John Smith. Diba? So i-check mo yan. First and last name of the client. So how would you know the first and last name of the client? You verify it against the client ID band. Diba? Sa kanyang armband. ID or the patient's armband. Well, aside from ID band or armband, okay? Or may mga institutions kasi na walang ID band or armband. Just like in the long term, in the rehab, sa amin kasi wala kaming armband eh na ini-scan, di ba? So kapag walang armband ini-scan, what can you do to verify if it's the right patient? You can ask the patient's name. As a patient, can you tell me what is your first and last name? Ayun. So hindi ka pwedeng mag-announce John Smith, hindi pwedeng ganun. Kailangan you have to ask what is your first and last name. Alright, so kailangan masasabi niya yun kapag walang ID band or armband. Pero pinaka-safe pa rin yung ID band armband. Kasi ini-scan natin yan. All right, sige, very good. Okay, what else? Aside from the first name, it's the birth date of birth. Good job. What else aside from the date of birth? We can also use the patient's, hospital. Okay, hospital or case number. Or also known as your MRN, medical record number. Tama? Hospital case number or your medical, nag-ano naman si sir, allergy ako. Hospital case number or your medical record number, that can also be used. Ayun. Alright, very good, Laurie. So, pwede rin natin gamitin si Social Security Number. Good job. SSN. Naalala ko yung mga students ko na nag-a-apply for NCLEX no? Sabi nila, sir, gusto po naming mag-apply sa California. Ayan, sabi ko, kailangan po ng Social Security Number para makapalay ka ng NCLEX sa California. Tapos ang binigay niya sa akin yung kanyang SSS. Ano, iba po yun ha? Yung SSS pang Pilipinas po yun ha. Okay, sige. So, kaya hindi tayo maka-apply agad sa California for your NCLEX. No? So, gusto mo doon, nandun yung mga kamag-anak mo. Apply ka muna sa ibang state, tapos saka na lang natin i-endorse. Kasi pagdating mo dito sa US, mai-issue yung iyong Social Security Number. Pagpasok mo sa border. Ayun, doon ka nila i-issuehan ng Social Security Number provided that you have a paperwork as an immigrant or as a worker in the United States. So, yun. So, ito yung kailangan, SSN, ITIN, or sa mga ibang country, the national ID. Diba? Just like when I was working in the UAE, I was once working in the UAE, we have what they call the Emirates ID. And our Emirates ID, that's our national ID, ano? Hindi tulad sa Philippines, ano? Daming klaseng ID. May PRC, may SSS, may UMID, 'di ba? Iba't ibang klase may ang daming ID sa Pilipinas, 'di ba? Ang daming hinihingi requirement. Okay, sa ibang bansa ginagamit lang national ID. Nandun na lahat ng information about you. Alright, sige. So clear tayo dito ha. So the national ID in other countries can also be used. What else aside from a national ID, your ITIN, that's your identification or tawag na dito ay tax. Okay. Ano na yun? Individual tax identification number. Individual tax identification number. That can also be used. And of course, the patient's photograph. The patient's, huwag kalimutan si photograph ha, pakidagdag to. Lumabas ito, select all that apply. A nurse is verifying the client's identity, which, okay, information can the nurse obtain? Select all that apply. So, dapat alam mo yan. So, we could use the first and last name, the date of birth, hospital case number or medical record number, SSN, ITIN, national ID number, and the patient's photograph. So, that's how to identify the right patient. Okay, very good. Next, let's talk about number 4. What is number 4? Okay, aside from the right patient, we need to follow the right time. When you administer the drug, we need to follow the right time. Okay, so how would you know the right time? Of course, you check for the doctor's order for the frequency. You check the frequency. Okay, you check the MAR. Kailan ba siya binibigay? So what would be the frequency? So say for example, ang frequency na binigay sa kanya is 2 times a day. So kung 2 times a day, pwede mo yang ibigay BID. So pwede siyang 6 a.m., 6 p.m. or 8 a.m., 8 p.m., di ba? So you have to check for the frequency. So say for example, TID, 3 times a day. So kung 3 times a day, that would be given every 8 hours, di ba? Ayan, sige. Next, you check also on the MAR. Now, you have to remember that there should be a specific interval so that the peak of the medication can be achieved. So how do we ensure that the peak of the drug can be achieved? By giving it at the right time. So for your MAR, you can also follow your facility policy. Hospital or facility policy. Ano ba yung policy sa inyo? Okay, dito sa amin, ang policy namin, we can administer 1 hour before the time and 1 hour after. So say for example, ang nakalagay doon sa drug administration, it should be given at around 8 p.m. or at bedtime. So kung at bedtime yan, ang pwede na namin ibigay starting kung 8 p.m. yan, pwede na ako mag-start magbigay ng 7 p.m. until 9 p.m. Ayan. So it depends on your facility or hospital policy. Alright, sige po. So that's all about the right time when you are administering the drug. So clear tayo sa right time natin. Okay, so sige po. Next, let's talk about number 5. Okay, number 5, we have the right route. Number 5, okay, we need to take note that it's the right route. So pag sinabi natin right route, it's the method of administration. It's the method of administration. How would you know that it is the correct method of administration? Of course, i-check mo pa rin doctor's order, diba? You check also the MAR. Okay, for the appropriate route of administration. So mamaya tayo mag-focus, magdi-discuss ako ng different routes ng drugs. And number 6, we have your right documentation. So tinanong ka, okay, when is the best time to document? Okay, when is the best time? Okay, when is the best time to document? Answer, immediately after administration. Immediately after administration for safety to prevent, okay, ambiguity. To prevent ambiguity para hindi ma-double ang dose. Diba? Especially, okay, if there are also other nurses caring for that specific client, para alam natin na hindi tayo ma-double. Immediately, the best time to document is after the administration. Ayan. Sir, paano po pag nalimutan po inumin yung gamot? Pwede po ba double dose na lang? Yung next. Okay. Anong tawag? Typical practice po kasi sa mga households. Ayun. So, depende, no? Yung doubling of the dosage would be depending on ano, depending. Pag nakalimutan, so depende siya sa specific drug. So, say for example, digoxin, nakalimutan. Hindi mo naman pwedeng i-double ang dose ng digoxin. It can become what? Cardiotoxic. So, depende yan sa meds. No? So, pag nakalimutan, okay, example, pills, contraceptive, pwede mong doblehin yun kasi pills yun eh. That's a guideline for pills. So, depende yan sa type of drug. Nakalimutan. Diba? So, it depends on the type of the drug. Hindi lahat pwede mong doblehin. Okay? So, may mga specific drug kasi that can become toxic kapag dinoble mo yung dose. Alright, sige. So, clear tayo dun ha. So, basically, okay, that's what we call your right documentation. Alright, next. Let's talk about your next right, number 7. Okay, the next right is called the right client education. Sige, punta tayo sa right client education and what would be the content of our teaching. Right client or patient education. Now, when we talk about your education, that's what we call your teaching and learning principles. Teaching and learning principles. So since we are applying the teaching and learning principles, we need to assess the client's learning. Client's learning ability. We need to assess the client's learning ability. Guys, okay, pag sinabi kong may teaching, kailangan merong learning. When you are teaching, it should be, okay, ang end product mo, meron kang learning. Whatever, okay, type of learning curve, okay, whatever type of element, okay, or component of learning, whether that is you are teaching about cognitive, psychomotor, or affective. Cognitive, psychomotor, affective. Kahit anong tinuturo mo dyan, kailangan, okay, the patient will be learning at the end of the session. Okay, so first, you have to assess the client's learning ability. Okay, kailangan mo munang alamin. And remember, guys, that client education should be, okay, provided when the patient, okay, has already recovered from the acute condition. Kailangan mas matututo yan if the client has already recovered. Kaya nga sabi ni Saunders, client education or health education is a last priority. Kasi nga, kailangan there should be a learning ability during that time. So first, you assess the client's learning ability. Okay, what else aside from client's learning ability? Assess for hindrances or barriers. Ano ba yung mga barriers to learning? Example, if the patient has pain. Diba? The patient is currently developing shortness of breath, fever. Sa tingin mo matututo? Hindi. Assess for barriers of learning. Diba? Ano pa? Mental illness. So aside from learning ability, you have also to check for the barriers to learning. Okay, check mo yan ha, learning ability. Saan ba siya natututo? Okay, different types of technique. Natututo ba yan in terms of hearing? Okay, visual, diba? Kinesthetic. So yun. So assess the client's learning ability, then assess also for barriers to learning. Now, what should be the components of your instruction? So ito daw yung components when you are teaching the client number. Okay, first, we can teach about the purpose of the drug, the indication, and the contraindication of the drug. We can also, okay, discuss what would be the action of the drug. Now, when you are giving instruction regarding the action of the drug, be sure to use, okay, language that can be understandable. Avoid medical jargon. Dito lagi nagkakamali yung aking mga students. Nakalagay doon, the nurse is teaching a client about this drug. Which statement is the most accurate? Okay, ang pinili niya yung ano, example, nakalagay digoxin. We're going to teach the client about digoxin boost calcium ion inside the myocardium. What do you think? Pag yun yung diniscuss mo sa patient, you will be taking digoxin. Why are you taking digoxin? It's because it boosts the calcium ion within your myocardium that produces positive inotropic effects. Sa tingin mo, naintindihan ka? At tingin mo, naintindihan ka? Okay, ganun yung mga pinagsasabi mo doon sa pasyente mo. When we talk about the action of the, may hindi ka kung ikaw nga hindi mo maintindihan yun, di ba? Hirap na hirap ka. Siya pa kaya, di ba? So you have to avoid medical jargon. So pag nurse or HCP yung patient, oo naman. Oo, pero usually kasi yung mga pasyente mo dito, di ba? Hindi naman lahat sila nakapag-aral. Di ba? Baka mag-nosebleed sila, be, 'di ba? Akala mo ang galing-galing mo doon sa pagdi-discuss. Okay, ayan. Hindi ibig sabihin nun ay magaling ka. You have to what? To lower your level. Na kailangan na iintindihan kasi you are teaching eh. So if you are a teacher, hindi mo kasi maiiwasan pag nurse ka talaga teacher ka. That's one of your responsibility. So you have to, okay, take note what would be their learning ability. Ayan. So that is why you have to avoid medical jargon. So clear tayo doon ha. What else? Ano pa? Teach the client about the specific side effects. Sabi mo, these are the expected, di ba? Sabi mo, expected ito. No need to notify the doctor because these are normal. These are expected. What would be the adverse effect? When to notify the doctor? So, discuss mo yun. When to not, especially kapag for discharge na yung patient. When you should notify the doctor if there are adverse effects such as the following. So what else aside from adverse effects? Okay, you have also to discuss what will be the possible drug interaction. Maraming klase ng interactions ha. What are the interactions? It could be either food to drug, drug to drug, drug to drug interaction, food to drug interactions, okay, herb to drug at okay, interactions. Ayan. So ayan yung mga i-discuss mo. So di mga ipagbabawal mong food together with the drug, okay, drugs that cannot be combined at the same time, herbs that should not be taken together with that drug. Yan, i-discuss natin yan. Okay, when we talk about your clinical pharmacology. So these are the interactions. What else? Aside from that, you have also to teach the client about his or her patient's responsibilities when taking the drug. Patient's responsibility. So i-discuss mo sa kanya, when is the schedule to take the drug? Okay, it should be taken with water ba? With vitamin C? Diba? I-discuss mo yun sa kanya, what would be the specific patient's responsibilities when taking the drug. So those are the very important components when you are performing instruction. Okay, questions about your instructions? Wala. Right client education. Clear tayo sa right client education, ano? So number 8 na tayo. Okay, so don't forget number 8. Okay, the client has the right to refuse. Okay, right to refuse. So what should you do if the patient refuses? You have to take note the ethical principle. What ethical principle should we apply if the client has a right to refuse? Okay, ano ang ethical principle? Very good. That's based from the principle of autonomy. Pag sinabing autonomy, it means self-determination. So the client has his or her right, okay, to choose. May karapatan siya, that's his right. Lagi sila dito, I know my rights. Gaganunin ka nila palagi. No? So pag sinabi niyang ayaw niya, huwag mong pilitin. Guys, kapag ayaw niya, huwag mong pilitin. Kung ayaw niya, edi don't. Diba? Kung ayaw niya, edi don't. Diba? Hindi mo siya pinipil. Guys, dumating na tayo sa point ng buhay natin na hindi na tayo namimilit ng person. Diba? Hindi na tayo. Kung ayaw mo, edi wag. Diba? O sino bang magkakaroon ng adverse effect or sino ba magkakaroon ng ng hindi paggaling sa sakit niya? Di ba yung patient din, di ba? So basically what should you do? Say for example, okay, this is the situation. The situation is patient refuses. So what should you do first? Nursing intervention when the patient refuses. What should you do? Immediately perform instruction. Health teaching. Provide health teaching. Especially, anong magiging focus ng health teaching mo? About the use of the drug, the indication, and the purpose of the drug. So you have to provide health teaching. Diba? Gold yarn. Ay, at sige. Yun nga, pag ayaw niya, choice niya yun eh. Kung ayaw, huwag mo na pilitin, wag mo nang habulin. Diba? Ako hindi ako maghahabol sa pasyente. Hayaan mo sila. Okay, kung ayaw nila, wag. Ganon din sa pag-ibig, huwag mong habulin, be. Huwag mong habulin. Ayaw mo, edi wag, di ba? Sabi mo, ayaw kong tumakbo, ayaw kong maghabol, gagalaw dede ko. Sabi mo, ay, sorry. Sorry, wala ka nga palang dede. Alright, so the first thing that you have to do is to provide health teaching. Ayan po. So, provide health teaching next. Okay, after you provide health teaching and the patient refuses pa rin, anong sunod mong gagawin? You have to notify HE. And then you have to document. Okay, so again, ulitin ko ha, kapag ayaw niyang uminom ng gamot, anong gagawin mo? Okay, immediately provide health teaching. After the teaching, ayaw niya pa rin, notify the HCP and document. Okay, about the patient's refusal of the drug. So yun ha, okay, huwag mo siyang habulin ha. Sige, kung ayaw niyang uminom, okay lang. Sige lang, sabi mo sa kanya, lagay mo na lang, ito document mo as refuse, diba? So, walang problema. Next, number 9, okay, there should be right assessment. Okay, components tayo ng assessment. So what are the things that you need to assess for? Components. The components of our assessment before the administration, number 1, you check for allergies. Diba? Because some of the drugs, okay, dapat alam mo kasi ano yung drug na may contain ng sulfa. Diba? Uy, tinatanong yan sa exam. Which are the drugs that are sulfa containing? Select all that apply. Which of the drugs contains penicillin derivatives? Diba? Which of the drugs, okay, contains, okay, this specific type of medication. So may mga ganun eh. So you have to determine what would be the patient's allergies in terms of food and drug. So food and drug. So meron ba siyang allergies known, okay, from food and drug? Because some of the drug may come from these food sources or, okay, from may derivative of this drug. So first, you need to check for allergies. So very clear tayo dito sa amin, madali lang eh. Bakit madali lang? Kasi yung system na ginagamit namin, enter ko muna yung allergy. Pag admit ko ng patient, itatanong ko ano yung mga allergies niya, i-check ko sa chart from the hospital, ano yung mga allergies niya, encode ko. Pag na-encode ko, tapos may in-order ang doctor, kusa na siyang magno-notify. Okay, that this patient is allergic to this component. Ayun. So kaya safe na safe kasi computerized na siya, no? Kahit hindi ko sa ulo yung mga drugs, okay? Pero yung computer, yung system na identify niya kung allergic si patient or hindi. Galing, 'di ba? Ayun. So dito madali lang pero syempre, for the sake of NCLEX, you have to take note what are the specific components, okay? Okay, what are the specific okay components of each drug wherein the patient can be allergic with? Ayan. Sige, so check for allergies. What else aside from allergies? Ano pa po? Right assessment, you check okay, if the client is pregnant, LMP, especially if the drug that you are administering are considered as teratogen. You check the LMP, okay? That would mean if the patient is pregnant. Usually, hindi nga lang LMP, PT, pregnancy test, di ba? Should be performed. What else aside from pregnancy test? Ano pa po ang ina-assess natin? Vitals. Example, we monitor first the heart rate, the blood pressure, di ba? Before we give the drug. There are specific drug that can lower the heart rate or can increase the heart rate. There are drugs that can decrease or increase the BP, diba? So you have to check the vitals first. What else? Aside from vitals. Ano pa po? Ang check natin, check if the patient is, okay, having pain. Diba? Kasi may mga medication nagkakos ng ano, diba? Ng mga vasoconstriction. Yan. So definitely, okay, you need to monitor if the patient is having pain. What else aside from pain and vital signs? Labs. Diba? Chine-check din natin ang labs. Urine output. And specific labs and urine output. Okay, blood glucose, capillary blood glucose, or also known as your blood sugar. Diba? Kasi may mga drugs na nakaka-affect din ng blood sugar. Yan, labs. Specific labs can also be monitored such as your fluids and electrolyte level. Diba? Fluid and electrolyte level. Your complete blood count, especially pag mga antibiotics. And also your CMP, your comprehensive metabolic panel. Metabolic panel. Okay, lipid profile, 'di ba? Ano pa? Liver and kidney function. Liver and kidney function. So basically ito yung mga specific sa labs that we need to monitor before we give those drugs. So these are the components of your assessment. Questions, may tanong. Wala. Sigurado naintindihan? Very clear? Okay, last but not the least would be your number 10. Okay, number 10 is your right evaluation. Number 10, right evaluation. Okay, what do you mean by evaluation? So after you give the drug, you have to reassess. Pag sinabi kong evaluation, it's more of reassess. And you have to determine if there is a relief. Okay, if there is a relief. So you have to determine, okay, the effect of the drug. So meron ba tayong relief? Okay, meron ba tayong tinatawag na tolerance? Okay, the patient was able to tolerate the administration of that specific drug. Is there a relief from the signs and symptoms? So you check the effect, okay, of the drug to the patient. So check for the relief, check for the tolerance to the drug. All right, sige po. So those are basically your reassessing, okay, the patient so that we could modify the care plan as necessary. So basically, those are what we call the 10 rights of drug administration. Any questions regarding the 10 rights? May tanong po. Wala. Sigurado naintindihan ng ating 10 rights? Yes, yes, yes. Bigyan si Sir ng thumbs up sign. Sir, pa-screenshot po ng 1 to 5. Okay, sige, balikan natin ha. Okay, before we proceed with the next topic. Okay, 1 to 5. Okay, sige. Yan. Ito ba yon? Okay, 1 to 6, rather. Okay, nahimay na natin, ano? So you have to remember, if you know that the doctor's order is erroneous, ha? If you know that the doctor's order is erroneous, okay, we should clarify. Okay, question ni Sir. Sir, paano pag hindi namin makontak ang doctor? Anong gagawin? Sabi, clarify sa doctor eh. Pero hindi mo makontak ang doctor. What is the best thing to do next? Okay, pag hindi daw makontak ang doctor, what should you do? Okay, you have first to document the attempts of notifying the doctor. Document mo that you have notified through SMS, notified through phone call, pero hindi pa rin siya sumasagot. So the next thing that you have to do is to document the attempts of notifying the physician, and then you can also call your nurse manager. Ayun. So you have to immediately call your nurse manager. So, tawagan mo si nurse manager para alam mo anong gagawin mo. Kasi sila yung nakakaalam ng policy. 'Di ba? Minsan kasi hindi mo alam yung policy eh. 'Di ba? Minsan nakakalimutan natin, especially night shift. Kasi you can ask your nurse manager. So, wag kang mahihiyang magtanong. Now, if your concern is all about the forms of the drug, kung ang concern mo naman ay forms ng drug na meron ka, at tapos hindi yun naka-order, then you can also ask the pharmacist. If the concern is regarding the form of the drug, so you can also ask, okay, the pharmacist. All right, sige po. So clear tayo dun ha. Any questions regarding your 10 rights? Okay, thumbs up naman po from everybody. Thumbs up, thumbs up. Tingnan natin what would be the next topic. The next topic is all about different routes. And then after the routes of administration, we are going also to discuss about your parenteral and pediatric administration. Okay, we will also be discussing dosage calculation, and we do have time. I'll be discussing IV therapy. So let's have a short break first. Ayan, may natutunan ba on the introduction? May natutunan ba guys on the introduction? Yes, yes, yes. All right, so this is just an introduction. So before we continue with regards to your fundamentals and basic medication administration, let's have a short break of 15 minutes, and then after 15 minutes, we'll continue. Thank you so much. Enjoy your break, guys.
I used to float, now I just fall down. I used to know, but I'm not sure now what I was made for. What was I made for? Taking a drive, I was an ideal, looked so alive. Turns out I'm not real, just something you paid for. What was I made for? 'Cause I don't know how to feel, but I wanna try. I don't know how to feel, but someday I might. Someday I When did it end? All the enjoyment. I'm sad again. Don't tell my boyfriend, it's not what he's made for. What was I made for? 'Cause I don't know how to feel, but I wanna try. I don't know how to feel, but someday I might. Someday I think I forgot how to be happy. Something I'm not, but something I can be. Something I wait for. Something I'm made for. Something I'm made for.
It's been raining in Manila, hindi ka ba nilalamig? And it's been raining in Manila, hindi ka ba nilalamig? But if it's raining in Manila, hindi kita maririnig. So I'll be waiting in Manila kahit di ka nababalik. Maulan ba sa inyo pag bumubuhos dito? Paumanhin at mukhang hindi ko masasabayan ang iyong yapak sa pagngiti at pag-iyak, sa paglipad at pagbagsak ng araw-araw. Sa nilalamig pag wala ang mga tao. Madilim ba ang mundo? May kulang ba sa inyo na naiwan dito? Aalin ang ulan sa paradiso. Sakaling madulas ay dati malapit ka, ngayon walang kahati ng init pag maulan. Sana naman tumigil ang ulan. Kamusta ka na kahit wag nang sagutin? Di ba na wala kitab ng bituin? Sana ganun ka nga pa rin. Cause it's been raining in Manila, hindi ka ba nilalamig? Mahirap bang mag-isang nanginginig? And it's been raining in Manila, hindi ka ba nilalamig? Pag wala ang mga tao, madilim ba ang mundo? Kamusta ka na kahit wag kang sagutin? Di ba na wala ang kitab ng bituin? Sana ganun ka nga pa rin. But if it's raining in Manila, hindi kita maririnig. Nakahiga mag-isang nanginginig. So I'll be waiting in Manila kahit di ka na babalik. Andyan lang ang mga tao, andyan lang ang mga tala sa mansulok ng mundo.
Anytime I'm alone, I can't help thinking about you. All I want, all I need, all I see is just me and you. He giving me that good shit that make me not quit, that good shit. He giving me that good shit that make me not quit, that good shit. He gave it to me. 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 Anytime, anywhere, baby boy, I can just be here. Breathe me in, breathe me out, feel me up, running through your veins. He giving me that good shit that made me not quit, that good shit. He giving me that good shit that made me not quit, that good shit. He gave it to me. 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 Let me
I put that work on you every day when the night fall to the sun cold. You done fell in love with a bad guy. I don't won't compromise my passion. Just know what you do for me, I'm doing the same for you. I don't be tripping or making mistakes. I made too many in my past. That's why I fight for the things you believe in. I got your body and put it in drive, baby. Like I got keys in it. We about to take us a vacation. I'm about to put all this vintage loving on you, baby, like it was the late 80s. When you ride on me, baby, rotate it.
You're giving me the good shit that make me not quit. The good
Let me turn you
shit.
up.
He give it to me.
Every day, every day,
He give it to me.
every day, every day,
He give it to me.
every day, every day, every day.
He give it to me. Let me know. You give it to me every day.
Why did you go? You know that I'm out of time. I'm thinking about you when I'm in the mood. Hey Jude, put her in my heart with this song. It calms me down like a Percocet when I reminisce all the time we kissed. Yeah, I wanna see you all the time. You shine like the stars, got me falling apart, falling for you. They can't tell me to stop. Babe, you're all that I want. Blue butterflies, strawberry skies. Everything's better now that I'm here with you. Tears in my eyes, not saying goodbye. Everything's better now that I'm here with you. She wanna party all night, till we see the sunrise. We're only having good vibes. She like my little sunshine. Whoa, whoa, baby, come and talk to me. Walk with me, love with me. Let's go and live life with me. Cause baby, this is all that you need. Yeah, they can't tell me to stop. Babe, you're all that I want. Blue butterflies, strawberry skies. Everything's better now that I'm here with you. Tears in my eyes, not saying goodbye. Everything's better now that I'm here with you. Oh, why did you go? You know that I'm out of time. I'm sorry, don't leave. It hurts when I sleep. You're all that I need tonight.
Hi guys! Welcome to Top Rank. I was graduated year 2020 in the Philippines, and then after that, after my school, I flew back here in Washington, and then I applied for the NCLEX. And while waiting, I was working full-time, and then I also have 2 kids. So hindi siya talaga ganun kadali. After months of waiting, finally my ATT came in. And then honestly, I started to study on my own, but it didn't work because I don't know where to start, I don't know where to focus, I don't know what to study. So luckily, I have a friend na during that time ay naka-enroll siya sa Top Rank for NCLEX. So she recommended and she asked me if I wanna try it. So luckily I did. Kasi first video pa lang or Zoom class namin, nakita ko na yung dali nung the way na how they teach. Kasi hindi ka magfo-focus sa kung saan-saan. Kung ano yung ibinigay nila, just study it. And during the Zoom class kasi, my struggle was, since I'm living here in Washington State, so the time difference, I need to get up like, or I need to stay up like 10 p.m. until like 2 in the morning, which is sometimes hindi ko talaga magawa kasi may work ako the next day, plus I need to get up early. So, makes easier for me because they have recorded video na they can send me and then I can watch it sa time na free ako. But guys, to make sure na lahat ng mga video ay mapapanood ninyo. The good thing about it is based on my experience, if let's say I miss something, I can go back again and watch the video. So, it helps me a lot talaga. And then, after nun, during, what I noticed was, every time I watch video, of course, yung prop, sinasabi nila, remember this. Or, this is the actual, question in the exam. Stuff like that. Always highlight those. Kasi ganun ang ginawa ko. So, before ng exam ko, like 2 weeks before, ang ginawa ko lang is just read. Lahat ng notes ko, ni-read ko. Hindi ako gumamit ng ibang source. Only lang sa top rank. Kasi, sa top rank kasi is focus sila kung ano yung kailangan lang ng NCLEX. So, nakatulong sa akin yon. Tapos, of course, may time na parang nahihirapan na kayo, parang this is too much, I feel exhausted. So, yung days off ninyo, you can go out with your friends, just like what I did. We can go drive for 2 days or go somewhere with my kids and have fun. And then after nun, go back again and study. And then after nun, like, I struggle a lot. Sir Jeremy knows about it. But 2 days before my exam, I felt like more confident talaga. Although, struggle pa rin, pero unlike before na para akong pupunta ng NCLEX na not knowing anything. But after my review sa top rank, I feel much better and confident. Sana guys, yung video na to ay makatulong sa inyo and don't lose hope. Don't lose hope. Because if I made it despite of my age and, working with kids, I made it. So, kung nagawa ko, magagawa nyo rin. So, good luck sa inyong lahat. Enjoy nyo lang yung journey ninyo during top rank. Ako si Pinky Castro, NCLEX passer ng New York. Nag-review sa top rank at naging USRN. Sa top rank, sulit ka.
Alright, so let's continue our discussion. Ready na po ba? Can I see a thumbs up from everyone? Thumbs up naman po. Alright, sige po. So we are now at, the basic, principles of administration of drugs. So the first thing that we have to take note of is the proper way of administering, yung ating mga different forms of medication. Ayan, sige po. So let's talk about your routes of administration. So first, we have your oral route. Sige, start muna tayo with the oral administration. Sige, punta po ako sa aking mga types of oral medications. Alright, sige. Now, when we talk about oral administration, bakit ito ang ating ginagamit, the most common route of administration? This is considered as the most common route because this is highly economical. So ito yung mga advantages niya. It is economical, and at the same time, this is most common, this is accessible in terms of administration. It is economical, accessible, but one of the disadvantages is the slow onset. So ito lang po yung disadvantage of this form of medication. So I repeat, okay, oral administration is economical. At the same time, this is accessible. However, it requires absorption first, then distribution before, okay, the drugs, okay, can have its desired effect. Now, there are different forms of oral medication. Sige, isa-isahin natin na. So first, we have the scored tablet. Pag sinabi natin scored tablet, these are the ones, okay, drug that has a score. Okay, so say for example, this is a 500 milligram drug, and then we only require 250. Okay, question, can we cut, okay, scored tablet drugs? Pwede ba nating i-cut? Can this be cut into half? The answer is yes. So we can cut, okay, the drug. So tatanda na, pag ang tanong, pwede ba natin siyang i-cut? Yes, gamit ka lang ng ng ating drug cutter. May available naman yan sa ating cart, and then you can just administer the proper amount. So okay lang pala, no? Especially if your drugs are considered as scored tablets. So it could be, the scored tablets could be, example nito is quarter half. So pwede siyang into half, pwedeng quarter half. Alright, sige. Next, another form of the drug is called your enteric-coated and sustained release capsule. Guys, ito yung mga makikita mo sa drug. So pag nakita mo sa kanyang sa kanyang form, nakalagay EC, SR, XL. Yan. So pag nakita mo yan, EC stands for enteric-coated, SR stands for sustained release drug, XL, okay, means your extra release. Extra release. So if you can see these type of tablets, question, can we crush the medications? Pwede ba siyang i-crush? Crush and alter. Pwede ba? So, say for example, sir, yung patient ko kasi may dysphagia eh. So kailangan i-crush ko siya. So what do you think? Can this be crush and alter? The answer is no. These medications cannot be crushed. It cannot be altered because it has a specific timeline ng kanyang peak ng medication. That's why it's enteric-coated and sustained release. Now, for these, okay, forms of medication, you have to make sure that you need to notify the physician. You need to notify the HCP if the client may require a crushed medications, or we can notify the pharmacies so that they can, okay, they can provide another form of drug that can be crushed. Especially kung ito ay through G-tubes kasi yung ating feeding eh. G-tubes and G-tubes yan. Tapos mga ganitong klase ng tablets, then definitely it should not be crushed. Sir, crush na lang si patient, sir. Ay, wow. Wow ha. Okay, sige. Next, let's talk about your capsules. So now your capsules could be either powder in a capsule, in a vegetable capsule, or pwedeng gel naman siya in the form of gel. Okay, question. Kapag ito ay capsule and powder, can we, okay, place, okay, these in the patient's food? Pwede ba sa food? Ihalo sa food? Mix with food. Tanggalin natin sa powder, okay, tapos lagay natin mix with food. Can that be possible? Pwede ba? Mix with food? Siguro, ang pinaka-appropriate, if the client has dysphagia, sa may mga difficulty in swallowing, pwede siya, imimix mo, okay, with specific type of food, that can be easily swallowed. So, pwede naman siyang gawin, pero pag sinabi nating mix with food, halimbawa, doon sa tray, mix it with food tray. Yung food tray niya mismo, doon natin sprinkle, hindi pwede yun. Ulitin ko ha, kapag ang nakalagay sa ating exam is mix it with the food tray, sprinkle mo siya, the answer, no. But it can be mixed specifically on a certain amount. So, pwede mo kang gumamit ng applesauce, pwede kang gumamit ng ice cream, diba? Pwede kang gumamit ng yogurt, right? So that it can be, okay, can be swallowed by the patient. But if it's sprinkling on the food tray of the client, it can be. The same is true with your other tablets. All right, next, let's talk about your orally administered liquids. Okay, ano naman kapag liquids naman ang administration? How would you ensure the accuracy of its administration? So, paano mo malalaman na accurate yung administration mo? Now, what would be your method, okay, of measuring, okay, these orally administered liquids? Sige po, Uy, lumabas pala to, drag and drop. Okay, everybody, paki-take note, How are you going to prepare orally administered liquids? Okay, place the correct sequence in order. So, nursing procedure tayo. I think I have 4 or 5 options for the nursing procedure. So, procedure tayo, no? Number 1. What should you do? First, okay, open, okay, the medication bottle. Now, bakit uunahin mo yung opening of the bottle? Because while you are opening the bottle, you are also checking the label of the drug. I repeat, while you are opening the bottle, you are also checking the label of the drug. Okay, next. Number 2, aside from that, after you open the medication bottle, what will you do next? You need to place, okay, the medication cup. Place the medication cup on a flat surface. Ayan. Okay, place the medication cup on a flat surface. So that's number 2. All right, next. After you place the medication, you have to pour, okay, the medication. Okay, so you have to pour the medication in a cup. And then after you pour the medication, you have to wipe the bottle with a tissue. Guys, ang usual na nagkakamali po ang mga student namin dito sa drag and drop na ito, ang inuuna nila is to wipe before they actually pour the mali yun, hindi before ang wiping. We are talking about wiping with the tissue because meron siyang mga tinatawag na drips, 'di ba? Nagdi-drip siya eh. So ang ating danger doon, baka pumunta yung medication dun sa dun sa label. So when it comes in contact with the label, pwede niyang mabura yung label. Guys, yung pinag-uusapan natin na wiping, siguro sa yun, applicable sa ating vial. So pag mga medication vial, we wipe it with alcohol first before aspirating. That's for a vial. But if it's a bottle, okay, of medication for syrup or administration or liquids or suspension, you can wipe the bottle with the tissue so that, okay, the medication will not come into contact with the label. Okay, and number 5, after that, you need to close and recap. You have to recap. Close and recap the bottle. Ayan po, lumabas ito sa exam ha, drag and drop. Okay, how should the nurse prepare an orally administered liquid? Anong unang gagawin? Open the medication bottle, place the cup on a flat surface, pour the medication, and then wipe the bottle with a tissue, and then close and recap the bottle. Pakitandaan ito, itong procedure na ito. Alright, so clear tayo dito ha, paki-screenshot po so that I would be suggesting what are how do we ensure the accuracy? Ang magiging problem mo lang pag oral administration is the accuracy. So for us to determine that it is accurate, punta ka dito ha, these are the types of, especially sa mga PDA, these are the types of, methods for measuring. Ito yung mga ginagamit natin for measuring. Okay, so what are those? So first, we have your measuring spoon, we have your plastic syringes, we have what they call your calibrated nipple. This is a medicine cup. Ito yung diniscuss natin kanina. Next is your rubber tip syringe. Okay, this is called this is what we call your dropper. Rubber tip dropper. And this is your handheld spoon. So these are to measure the drug accurately, ang pinag-uusapan accuracy, these are the only acceptable, types of measurement that we can use. So clear tayo dito ha. So pag nakita mo doon guys, nakalagay place the medication on an empty nipple. O okay yon, walang problema yon. Ito yon, yung empty nipple. Hindi po, question, can we place the medication on the mother's nipple? Pwede ba ilagay natin yung medicine para mainom ni baby yung gamot, ilagay daw ang medicine sa mother's nipple. Will that be appropriate? Hindi. Huwag mo ilagay sa nipple ni mommy yung medication, ha? Okay, sige. Kasi pag nilagay mo yung medication sa nipple ni mommy, hindi si baby ang dedede doon. Baka si daddy yung dumi. Si daddy yung dedede doon, guys, di ba? Alright, so definitely it should not be placed on the mother's nipple. Ito yung pinag-uusapan nating empty nipple. Alright, so clear tayo. Questions, may tanong tayo dito sa oral administration. Okay. Now, sir, paano naman ang ating schedule of administering oral medication? It depends on the drug. Now, if the drug is, our concern is the absorption. So kung ang purpose mo is for the drug to be absorbed, so ang sagot mo dyan, it should be on an empty, stomach. So kailangan before meals. So kung ang concern ng isang nurse so that the drug can be absorbed, so ang pinakamaganda talaga dito, empty stomach, kung absorption ng concern. But if your concern is a drug is causing GA upset, when is the best time to take it? Natandaan, pag GA upset naman, answer, it should be with meals or after meals. So yan po ang tatandaan ha. So ulitin ko ha, kapag absorption ng ating purpose for the drug to be easily absorbed, it should be on an empty stomach or before meals. For clients with J upset, ang ating tinatawag na schedule with meals or after meals. Very good. Ito yung mga bawal na bawal pag oral administration. Avoid taking with the following. So bawal na bawal talaga alcohol. Yan. The drug should not be taken with alcohol. Drug should not be taken with caffeine. Okay? It should not be taken with caffeine or carbonated beverages. Pinaka-best talaga ang water, carbonated beverages kasi mas na-alter niya yung tinatawag nating medication, absorption. So it should not be taken with alcohol, with caffeine, with carbonated beverages, and some of the drugs should not be taken together with grapefruit juice. Example ng mga hindi natin tinitake together with grapefruit juice. Ano yung mga examples ng drugs such as digoxin, yung mga cardiac drugs such as your antihypertensives, diba? Calcium channel blockers, antihypertensive should not be taken with grapefruit juice because of the risk of toxicity. Si grapefruit kasi meron siyang specific na enzyme, okay, that can block the metabolism of the drug. So anong nangyayari? Tumataas ang tinatawag hindi na may metabolize si digoxin, si calcium channel blockers, nagkakause sila ng toxicity. So there are certain types of juices that should not be taken with a specific drug. So tandaan yan sa oral administration natin. Alright. Meron naman tayong mga drugs that should be taken whole with, swallowed whole with a glass of water. May mga ganun namang drug. No? May mga drugs din naman na pwedeng i-crush, may mga drugs na hindi pwedeng i-crush. So I hope na-discuss ko itong oral medications. Okay, questions, may tanong with oral administration. Okay, so let's talk about now your sublingual. Sige, ready na? Paki-screenshot po ito. Sublingual administration naman tayo and your buccal administration. Sige, unahin muna natin si buccal administration. So dito tayo kay buccal. Ready? Okay, sige. Punta ko sa whiteboard natin, ano? Alright, sige. So natapos na natin oral administration. So let's talk about now your buccal administration. Now, one of the best example of the drugs that can be administered, pag sinabi kong buccal, ang site sa cheeks, ha? Okay, it should be placed on the cheeks. Now, the most common example of the drug are your lozenge. Especially kung may mga sore throat, di ba? Lozenge. And some of these lozenge may contain alcohol products, di ba? Yung mga lozenge may mga alcohol products. Ito kasi usually lozenge are treatment for what? For sore throat. So it should be placed on the cheeks. Nursing intervention to prevent irritation. Di ba sabi nga ni Sir, lozenge sometimes may contain alcohol. So pwedeng mag-cause ng irritation sa mucosa. So you have to, intervention, teach the client to alternate the cheeks. Okay, alternate the cheeks. Okay, so say for example, for this morning, you use the right cheek. Okay, on the afternoon lozenge, you use the left cheek. So it should be alternate. So that's for buccal administration. Okay, next, what else aside from buccal? You have your sublingual. Ano yung mga example ng drugs naman na ina-administer sublingually? Example is your nitroglycerin. Nitroglycerin for anti-anginal drug. Okay, there are also antihypertensive drug, such as your clonidine. Diba? Clonidine catapres can also be placed under the tongue. Ayan, sige po. So those are the examples of your sublingual medication. So for this sublingual, tandaan, nursing intervention, okay, avoid swallowing. Avoid swallowing. Saan dapat ang ating site? It should be placed where? Under the tongue. Bakit under the tongue? Rational, because it has a lot of blood vessels. So, ibig sabihin, these drugs can be greatly absorbed under the tongue. So, avoid swallowing the drug. Next, okay, when you are giving sublingual administration, aside from avoid swallowing, you have to position the patient, okay, and the best position is sitting or lying. Why? These drugs can cause vasodilation. So, anong danger pag ang drug nagkakos ng vasodilation? What will happen to the blood pressure if the drug is causing vasodilation, guys? Ano nangyayari sa blood pressure? It can cause the blood pressure to go down. It can cause the blood pressure to go down. So if the blood pressure goes down, what will happen? It can result into orthostatic hypotension. And this is the very reason why you place the patient on sitting or a lying position. Very good. Maliwanag tayo dyan, ha? So this is for safety. This is for safety. And you have to teach the patient to gradual, change in position. Because of the drug that causes what? That causes orthostatic hypotension. Sige, so clear tayo, ano? Okay, questions, may tanong. Questions. May tanong po. Bigyan ako ng thumbs up sign, guys. Thumbs up sign for sublingual administration. Again, do not swallow the drug. It should only be placed under the tongue. Hindi ko i-discuss about specifics sa nitroglycerin at clonidine. I-discuss natin yan sa clinical pharmacology. Alright, sige po. So next route natin, aside from your buccal and sublingual, let's talk about your inhalation. Okay, inhalation tayo, ha. So ang focus ng aking treatment, okay, for inhalation are your metered dose inhaler. Okay, metered dose inhaler, example. What are the drugs that can be given inhalation? Okay, example would be your salmeterol. Salmeterol plus fluticasone. Narinig na to? Salmeterol plus fluticasone. Ang brand name niya si Advair Discus. Narinig na? Diba? Tapos pwede rin si budesonide. Okay, budesonide. This is what we call budesonide. This is a form of steroids. Diba? Steroid siya. Ano nga tawag natin dun sa ano, dun sa mga powder, mga ano siya, yung mga powder, aerosol preparation. It's an aerosol preparation. So example, salmeterol, fluticasone, budesonide, right? Puffs, very good. Ayan. Sige. So, okay. So, you can administer these drugs and, okay, the route is where? Okay, saan ito ina-administer? Site is through the mouth, okay, going to the respiratory tract. It should be inhaled through the mouth, okay, towards the respiratory tract. Bakit ginagamit na route sa inhalation? Because the alveoli are rich in capillary network and the drug can be easily absorbed. Ayan. Sige. So, sir, ano po ang lumalabas sa exam regarding this? Ang lumalabas dito, the procedure of administering your, okay, meter dose inhaler. So, procedure tayo, place the correct order in sequence, drag and drop. So, unahin natin, ano, drag and drop tayo. How to use your meter dose inhaler. Number 1, positioning. So, place on what is the best position. Okay, during administration, it should be sitting or upright. Okay, next. Number 2, okay, instruct the client to perform breathing exercises. So breathe, okay? Inhale and exhale for some time. So deep breathing muna tayo. Ensure that the passage are clear. Kailangan clear. Kasi kapag hindi clear, pag meron siyang mga secretions, then definitely ang problem, hindi natin ma-administer. It could be a hindrance. Okay? Pwedeng ma-block yung administration ng drug. So instruct the client to breathe, inhale and exhale. Be sure that the airways are open and patent at this time. Sige. Next, after breathing, what's the next thing that you have to do? You have to shake MDI vigorously. Okay, shake mo for 5 to 15 seconds or 5 to 10 seconds. Okay na yan. Shake mo siya. And then after you have shake the meter dose inhaler vigorously, the next thing that you have to do is place the MDI into the mouth. Okay, place it into the mouth. Guys, now kapag okay, ang atin ay without spacer ha. Kapag without spacer, usually kasi may spacer siya. Pero if the drug has without spacer, you should place it about ilang inch from the mouth. Usually about 2 to 3 centimeter or an inch. Okay, tatanda na kapag po wala siyang spacer, it should be placed about an inch or 2 to 3 centimeter from the mouth. So place it into the mouth. Okay, tandaan ha, without spacer, you should have at least 2 to 3 centimeter or an inch distance from the mouth. Okay, next. After it is placed into the mouth, what should you do? You have to administer during inhalation. Administer during inhalation and then instruct the client to hold the breath. For how many seconds mag-hold ng breath? Anyone? How many seconds should we ask the client to hold the breath at least? Okay, 10 seconds. Okay, hold the breath for at least 10 seconds. Tama ba? 10 seconds, no? Yes. All right, next. After you hold the breath for 10 seconds, you have to what? You have to breathe, okay? Breathe or exhale slowly using pursed lip. Exhale slowly using pursed lip. Okay, next. Now, if, okay, the instruction is 2 puffs. If the instruction is 2 puffs, there should be an interval. Okay, allow interval for about 1 minute or 60 seconds. So, hindi pwedeng immediately bigay kagad yung second puff ha. Kailangan there should be a space. There should be 60 seconds so that the medication will be dispersed first into the respiratory tract. So, interval for the next puff is 60 seconds. Next, okay, after the administration, we can repeat the procedure, di ba? Repeat, okay, the procedure. Okay, after 60 seconds, repeat the procedure and then document. Okay, so sorry po. Repeat the procedure and then, okay, wash, rinse the mouth after the administration. Guys, why do we have to rinse the mouth? What would be the rationale? Ano nga ang content ng ating mga meter dose inhaler? The content of meter dose inhaler, most of them has steroids, 'di ba? Ano ba ang effect ng steroids or anti-inflammatory? Okay, guys, remember that inflammation is a protection of the body. I repeat, inflammation is a protection of the body. Protection siya. So ang problem mo, these drugs are anti-inflammatory. So, anong ibig sabihin kapag anti-inflammatory? Tinatanggal mo yung protection. So, pag tinatanggal mo yung protection, so there is a greater chance of developing oral thrush. Very good. Tama. So, there is a risk of developing candidiasis. So, we rinse the mouth, okay, with water. Bakit kailangan with water? So that to prevent oral thrush or candidiasis. Very good. Then, after you rinse the mouth with water, what's the next thing that you have to do? Okay, you need to store. Okay. So we can also rinse the canister or the spacer. We rinse only with water. Hindi tayo naglalagay ng alcohol doon, ano? Especially sa mga bata kasi yung alcohol baka ma-inhale ng bata. So hindi natin nilalagyan ng alcohol. So we just rinse it with water. The mouth should be rinsed with water together with also your medication and store MDI at room temperature. Sir, paano po yung expiration ng medication? Depende sa drug. Merong binibigay po ang pharmacy na list. Usually, makikita mo, halimbawa, Advair Discos, 30 days lang yan. Diba? Spiriva, usually 90 days naman si Spiriva. Okay. Si budesonide, usually naman 60 days yan. So, yun. Binibigay naman ng pharmacy ang list kung ilang days pwede natin siyang i-store after opening the drug. So, hindi naman very specific si NCLEX doon. Usually, that's for nursing practice. Alright, so that would be your procedure. Okay, place the correct order in sequence. Guys, pakitandaan po itong mga to. Lumalabas ito, okay, in your drug and drop procedures on how to administer this medication. Alright, sir, paano if the client develops oral thrush? So side effect tayo ng ating mga meter dose inhaler. Side effect is your oral thrush or also known as your candidiasis. So what should you do whenever oral thrush occur? Okay, nursing intervention, notify. Okay, so after you notify the doctor, okay, implement HCP's order. So the doctor will ask you to, okay, administer the drug for oral thrush. Implement HCP's order. So usually, ang ating ina-administer po na doctor's order is, ano nga ang tawag natin doon? That's your suspension, your oral suspension. Ano? So we give nystatin, drug of choice. Very good. Nystatin. So how do we administer nystatin? How do we administer nystatin? Okay, your instruction is to administer nystatin, you need to ask the client to swoosh and swallow. Very good. Swoosh and swallow. So pag ang tanong sa'yo, should it be spit or swallow? Anong sagot mo? Okay, ang sagot mo, bakit kailangang iswallow? Swallow all the way. Very good. Bakit? That's the primary reason why you have to swallow the drug all the way. Question, kung may oral thrush ang mouth, possible ba na may oral thrush din ang throat at ang esophagus? Yes, possible. So kapag may oral thrush ang mouth, may oral thrush din ang ating throat, may oral thrush din ang ating esophagus. So that is why for the total coverage, then we have to instruct the client to swallow it. Very good. Now for infants, for newborn infants, you have to administer it through swabbing. Swab, okay, after feeding. Swab after, hindi before, kasi kapag before feeding, pwede siyang ma-wash out. So we have to swab for infants after feeding. So that's how to administer your nystatin. Okay, sige, clear tayo dyan ha. Questions? May tanong? Wala. Sige, so very good. Sabi ni Sir Justin, iswallow kasi masarap. Ano raw? Hindi ko alam, hindi ko pa nalasahan yung gamot, guys. Huwag niyo akong tanungin dyan. Okay, sige po. Question, may tanong tayo. Inhalation, administration. Hindi ako magdi-discuss ng how to do nebulization ha, kasi ang nebulization usually is part of the responsibility of your respiratory therapist. Sige, itong MDI talaga ang ina-administer ng nurse. Guys, pag nakita mo Spiriva ha, huwag mo ipaswallow yung Spiriva kasi mukha siyang capsule. Ini-inhale yun, yung capsule na yun. Meron kaming isang kasama dito, nurse, pinainom yung Spiriva, be. Nakalagay na nga Spiriva, do not swallow. Oh my God, pinainom niya ba yung Spiriva? Buhay pa naman yung pasyente. Sige po, any questions? May tanong ha? Pag nakita mo yung mga drugs na yun, these are form of inhalational medication. Ayan, sige po, nagreklamo. Nagreklamo nga lang yung pasyente. Sabi niya, ba't ang laki? Ang hirap iswallow, di ba? Alright, sige po. So we're done with your inhalational drug questions. May tanong tayo dyan. So na-discuss na natin siya. So last but not the least, let's talk about your parenteral administration. Uy, meron pa pala akong mucous membrane. Sorry. Bago tayo sa parenteral, let's talk about your topical. Muntik ko nang mamiss si topical. Okay, medyo marami-rami pa ito. Okay, sige po. So let's talk about your topical administration. So pag sinabi nating topical, it's either that's the administration on the skin. Okay, so kapag sinabi nating skin, it's in the form of the following types of drugs that can be administered. So pwedeng mag-apply daw ng cream, medication ointment. Yan, ano pa? Actually, ointment, gel, ano pa, aside from gel, we have also your paste, we have also your patches. Yan. So ito yung mga very common na nilalagay natin sa ating sa ating skin. So cream, ointment, gel, paste and patches. Alright, sir, alin dyan ang laging lumalabas sa exam? Okay. Ang laging lumalabas dyan sa exam, example on administration, ang favorite nila, capsaicin. Capsaicin gel. Familiar kayo sa capsaicin? Okay, capsaicin is derived from cayenne. Okay, galing to sa siling labuyo. This is derived from cayenne. Usually, saan ito? Indication ito. Nilalagay ito, treatment ito sa merong arthritis. Painful joints. Narinig na ito? Yes, galing to sa sili. Maanghang siya. So, paano siya ina-apply? Okay, so you have to apply the drug and then nursing intervention, wash. Okay, so first, you have to wear gloves, syempre. Wear gloves when administering. And then, after the administration of the drug, you have to wash it off after 30 minutes. Wash it off after 30 minutes and at the same time, avoid warm compress together with the capsaicin gel. Avoid warm compress, okay? Especially when you are administering capsaicin gel. Kasi nga, it can cause burn injuries. Ayun, sige. So clear tayo dito ang capsaicin. Sir, ano pa lumalabas aside from capsaicin? Lumalabas favorite nila nitroglycerin patches. Ayan, sige. So pag nitroglycerin patches naman, okay, ano po ang dapat tandaan dito? Okay, nursing intervention, wear gloves, and then rotate the site. Okay, sige. Nitroglycerin patches, wear gloves, and then rotate the site. Okay, sige. What would be the interval? What would be the interval? Okay, tuwing kailan po siya ano daw po yung interval ng ating administration? Answer, 72 hours or 12 hours? Ang interval, it should be 12 to 24 hours. Ayun. 12 to 24 hours. O, saan yung 72 hours? But that's for fentanyl. Uy, naghahalo-halo na ha. That's for fentanyl pa. So usually it is applied for about 12 to 24 hours. Ayan. So the interval is 12 to 24 hours. Bakit kailangan may interval? What will be the rationale? The rationale is to prevent tolerance. To prevent tolerance from the drug. So pag sinabi kong tolerance, they may require a higher doses so that it will become effective. Now, please remember that nitroglycerin patches produces a long-term effect. So long-term ito ha. So ang ating sublingual nitroglycerin short-term, ibig sabihin fast-acting. Ito naman long-acting siya. So it will, provide relief from chest pain for a longer period of time. So yun naman si patches. Okay. How about your fentanyl? Okay, fentanyl patches. So nitroglycerin patches ito for chest pain ito ha. Si fentanyl patches naman for the patients with a chronic pain. Okay, may mga chronic pain yan sila. So fentanyl patches, okay, tatandaan pag nag-a-apply ng fentanyl patches, just like your nitroglycerin, wear gloves so that you will not absorb the fentanyl. Rotate the site of administration. And then the interval is how many hours? Answer, 72 hours. Ayun. So yun yung pinagkaiba ng nitroglycerin kay fentanyl. Okay, very good. So, okay, the interval would be 72 hours. Very good. Should not be placed on hairy area. Rotate the side. Okay, it should be on the hairless area of the chest. Okay, rotate the side then, hairless area then, Guys, pag may nakalagay sa nitroglycerin, place it on the hairless area of the legs. Mali yun, ha? Hindi yan sa legs nilalagay, sa chest kasi that's for chest pain. Alright, sige po. So, fentanyl patches, okay, usually for chronic pain, wear gloves, rotate the site on the hairless area and the interval is, it should be placed every 3 days, 72 hours. Okay, sige. Next. Scopolamine patches. Okay, nakikita ko rin ito sa exam. Okay, pag scopolamine patches naman, okay, where should be the site of administration? Usually, it's for your vertigo. Okay, so kapag scopolamine patches, that's for your benign positional vertigo. Doon siya binibigay, no? No, so where is the site? The usual site is, okay, it is, okay, behind the ears. So it should be placed, the patch should be placed behind the ears. And what would be the interval of administration? The interval is also 72 hours. The interval is also 72 hours. So 3 days ang interval. Okay, that's also known as scopolamine. Anong classification is scopolamine? So pag ang tanong classification answer, scopolamine is an anticholinergic drug. Anticholinergic drug. Diba? Ang source ng vertigo minsan kasi ang daming water, yun may mga ano no, maniors. So tandaan, kapag anticholinergic, it can cause dryness. Kaya siya nilalagay doon sa behind the ears. Alright, so para ma-drain yung fluid, para ma-dries up siya. So pag dry yung fluid, then definitely mas magiging maayos ang tinatawag nating hearing ni patient. So that's what we call your scopolamine. Tandaan, classification, anticholinergics. Alright, so those are the most common, most common na mga topical drugs, okay, that can be asked in the actual exams. Alright, sige po. So next, what else aside from topical administration? Aside from the skin, okay, it can also be an ophthalmic administration. Ophthalmic administration. So pag ophthalmic administration tayo, it could be in the form of eye drops and eye ointment. Sige, punta tayo kay eye drops. Ready? Procedures, okay, ng eye drops administration. Okay, place the correct order in sequence, drag and drop. Ito yung lumabas. So what's the first thing that you have to do? The first thing that you have to do, number 1, is to ask the client to look at the ceiling. Ask the client to look at the ceiling. That's the first step. Next, after asking the client to look at the ceiling, what's the next step? Okay, you have to retract the eyelids using your forefinger or your fingers. Ang ginagamit yung thumb, pwede mong i-retract mo or yung forefinger. So retract the eyelids. Next, administer the correct number of eye drops. Okay, using side approach. Okay, question, bakit side approach? Side approach so that we could prevent, okay, it can prevent the blinking of the patient. Thus, it will also prevent the direct administration into the eye structure. So, hindi natin i-administer ang drug directly dun sa eye structure kasi ang danger pwedeng mag-cause ito ng damage sa cornea. So, that's the main reason why we have to use a side approach. Next, after, okay, administering, instruct the client to close the eyes gently. So walang magsasagot ng tightly kasi kapag tightly, it can cause the medication to escape. It can cause the medication to escape. So just instruct the client to close the eyes gently. And last but not the least, number 5, press the nasolacrimal duct, okay, for 20 to 30 seconds. So what's the main reason? Rational. Okay, ang tawag na ibang term natin dyan is your punctal occlusion. What is the rationale? Bakit kailangan i-press ang nasolacrimal duct? Bakit kailangan ng punctal occlusion? To prevent systemic absorption. Kasi sometimes, okay, the drugs are for glaucoma, di ba? Tapos yung mga drugs for glaucoma are beta blockers. And, di ba? So, dahil mga beta blockers yan, pwede yung mag-cause ng bradycardia. So, para hindi siya ma-absorb sa total circulation, yes, so definitely, we have to press the nasolacrimal duct for 20 to 30 seconds. Guys, paki-highlight ito ha, lumalabas, eye drops administration procedure. Okay, question. May tanong tayo sa eye drops administration procedure. Common NCLEX question. Drag and drop. Ay, pakain na ni sir yung mga lumalabas sa exam, ano? Ayan, sige, next. Okay, ophthalmic administration, we have the administration of eye ointment. The administration of eye ointment. Sir, ano naman po ang lumalabas pag administration of eye ointment? So, okay, ang lumalabas sa exam, newborn prophylaxis. Okay, lumalabas daw sa exam, newborn prophylaxis. So, pag tinanong, when is the schedule? Sagot mo, within 1 hour after birth. Okay, drug of choices, okay, for the newborn prophylaxis. Answer, okay, drug of choice are your erythromycin and tetracycline. Okay, so the schedule is within 1 hour after birth. Drug of choice, erythromycin, tetracycline. Purpose, okay, to prevent ophthalmia neonatorum. From the word prophylaxis, to prevent ophthalmia neonatorum. So what is ophthalmia neonatorum? This is the acquired eye infection or conjunctivitis, okay, from the mother during delivery, caused by what? Okay, to prevent, okay, gonorrhea, okay, infection of the eye, and chlamydia. So pag nakalagay, it will prevent, okay, infection, okay, caused by the delivery of a mother with syphilis. Pag nakalagay mother with syphilis, mali yun ha. It's to prevent ophthalmia neonatum or the bacterial infection or bacterial conjunctivitis caused by gonorrhea and chlamydia. Especially kung si mami may STD during birth. Diba? So that's the purpose. So ulitin ko ha, schedule, pwede ma-delay basta for as long as it could be given within 1 hour. Okay ma-delay, okay ma-postpone. Kasi ang unang-una kasi natin yung skin-to-skin contact, kung maaalala mo yun. Diba? Right, so after the skin-to-skin contact, that's the time that we have to provide the necessary newborn care. And one of which is the administration of your eye ointment. Okay, the site of administration, ang sagot mo, it should be placed on the lower lid of the eye. Okay, amount, okay, of administration, ribbon-like amount. Amount of medication that is administered, ribbon-like amount. And important nursing intervention, avoid flushing. Okay, avoid flushing with water. Kailangan you should keep in contact with the eye. Avoid flushing, okay, with water. And tandaan, you can continue to administer even with eye edema. You can continue to administer even, okay, continue to administer even with eye edema. Bakit? Kasi yung eye edema ng patient, ng newborn is expected. Expected is because of the delivery process, the labor process. So kahit may eye edema nakalagay doon ha, you would not withhold the administration, but instead you have to continue the administration because eye edema is not a contraindication. Remember, eye edema in a newborn baby is expected. Ayan, napunta na tayo sa ano, no? Maternal and child. Sorry na. Okay lang ba? Nagja-jump-jump si sir. Minsan may MS, minsan may OB, minsan, ano ba? Okay lang ba? Kasi alam ko ito yung lumalabas sa exam. So that's why. Kaya huwag kayong magugulo na, ano ba yan? Bigla na lang naging maternal si sir, naging OB na, naging pedya. That's fine kasi these are part of your exams. Okay, sige po. Helpful naman, ano? Alright, sige po. Next. So, tapos na tayo sa ophthalmic administration. So, let's talk about your otic drops. Okay. Ear, okay, ear administration. So, ear administration or otic. Okay, otic drops or otic administration. So, pag sinabi kong otic, we are talking about the ear, okay, administration. So, administration sa ating ear canal and the middle ear. Now, you have to remember, okay, that when you are administering, be sure that, okay, it is warm first. Kailangan na warm siya. So, nursing intervention. Okay, warm the solution. So how do you warm the solution? What are the techniques? Hindi tayo nag-administer it cold kasi it's very painful. Kapag mga ear, okay, ear infection yung condition niya. So painful yung cold administration. So kailangan you have to warm the solution. What are the techniques? You can roll it with your palm. I-roll mo with your palm. Okay, yan naman. Using a warm towel, i-warm mo yung solution using a warm towel. So you have to warm the solution first. Next, administer. Okay, when you administer, you have to straighten the ear canal first. Okay, how do you straighten the ear canal? It depends on the age. Okay, if your child is less than 3 years, okay, pag yung bata less than 3 years, how are you going to straighten the ear canal prior to administration? What will be your answer? Pull the pinna of the ear down and back. Diba? Yun ang palatandaan mo pag less than 3 years. Pull the pinna down and back. Pag adult, 3 years, okay, and okay, above 3 years and above, so ito ay mga ano, no, adults na, no? Okay, kapag ang patient mo naman ay 3 years, okay? Above 3 years old, yan, above 3 years old na ang patient mo, pull the auricle up and back. That's to straighten the ear canal. Now, guys, remember, less than 3 years, okay, pull the pinna down and back. Kapag more than 3 years, pull the auricle up and back. Another thing, okay, avoid administering directly to the tympanic membrane. Sa tatandaan nyo na, avoid administering directly kasi pwedeng mag-perforate ang tympanic membrane. So when you are administering, the site of administration, it should be only administered at the ear canal. Tatandaan yan ha. The usual site of administration is at the ear canal. We do not put it directly to the tympanic membrane. It can cause perforation. So pwedeng ma-damage ang tympanic membrane. Parang yung kanina sa eye drops, diba? Sabi ko, bawal sa eye structure, side approach ka lang lagi. Kasi nakakadamage siya ng cornea. Alright, so the same principle with your otic drops. So we avoid the damage or prevent, okay, yung damage natin sa ating middle ear or tympanic membrane. Sige, so clear tayo dito. Questions about the otic administration? May tanong? Wala. Intranasal tayo. Okay, let's talk about your mga nasal spray administration. Intranasal administration, nasal spray. Indications. If the otic drops are usually for those with otitis, diba? Otitis externa, otitis media. Nasal spray naman usually are for those with nasal congestion. So, sino ba yung may mga nasal congestion? Ang content ng nasal spray is usually steroids. So, usually it's indicated for those with rhinitis and sinusitis. Could be allergic, viral rhinitis, sinusitis. Ayun. Sige. Sir, perforation po saan? Sorry, naglag. Bawal mag-administer directly to the tympanic membrane to prevent perforation of the tympanic membrane. Kasi baka mag-perforate si tympanic membrane, Ma'am Edna. Ayan, so ulitin ko ha, nasal spray administration for those with rhinitis and sinusitis. Nursing intervention, when you are administering nasal spray, okay, gently blow the nose. Okay, before administration. Gently blow the nose before administration. So tanong, sino ang contraindicated mag-blow ng nose? Lumabas sa exam. The nurse is administering nasal spray. Which do you think should be a contraindication? Okay, blowing of the nose before the administration. So ang sagot mo, those clients with increased ICP. Lumabas ito, ha? Kasi bawal talaga mag-blow ng nose, lalong tataas ang intracranial pressure. Neuro naman. You have to remember that. So gently blow the nose prior to the administration. Okay, position for administration. Answer. Okay, position. The head should be on an extended head and neck. Should be on extended or also known as neutral. Midline. Okay, so tandaan, naka-neutral midline, hindi natin igagano yung ating ulo ha, yung to the left, to the right, o kaya naman hyperextended, hindi po. So the position is extended, okay, neutral and midline position. Then we should administer it, okay. Administer it while the head and neck is on extended, neutral, or midline. Okay, bakit hindi natin nilalagay sa hyperextension? We avoid the hyperextension of the head and neck during the administration. Okay, bakit? Kasi anong pwedeng mangyari? It can just cause post-nasal drip. So pag nag-post-nasal drip, anong mangyayari? Pupunta lang siya sa throat, luluwa niya lang yung medication. So that's why the head and neck should be on extended, neutral, or midline upon the administration. Alright, sige po. So clear na clear po tayo dito ha. Okay, usual side effect that you have to monitor, ano, na very common. The usual side effect na very common na naranasan nila is epistaxis. Mas nagiging prone sa bleeding na kasi numinipis yung, kasi anti-inflammatory siya eh. So kung anti-inflammatory, it can cause what? It can cause the thinning of the mucous membrane or the capillaries. So very common side effect, epistaxis. Alright. Sige po. So those are what we call your administration of your nasal spray. Questions about your nasal spray administration? Wala. Very clear po ang ating mucous membrane administration. Sana discuss natin, ano? Yes, okay, na-cover ko lahat that I need to cover. Yes. Alright. Sige. So, na-cover natin siya. Okay, last but not the least would be your parenteral. Okay, learning pa rin po. Okay, kaya pa. Parenteral tayo. Siguro yung calculation, baka ipagpabukas natin yung calculation pag hindi natin makover. Sige, bigyan si sir ng thumbs up sign if everything is clear related to our routes. Okay, your topical. Okay, sige po. So learning pa rin tayo. So let's talk about now your last but not the least is your parenteral administration. Sige po. Okay, next topic tayo, parenteral. Now, what do you mean by parenteral? So pag sinabi nating parenteral, it means to say injection. Okay, parenteral is also known as injection. So ito po yung ating parenteral administration. So it could be your intradermal, it could be your subcutaneous, it could be also your intramuscular. All right, sige po. So let's proceed with the discussion of your parenteral route. Okay. Okay, definition, okay, injection, okay, to the surface, okay, of the body. Okay, so it could be of different routes. Okay, under parenteral, first we have your intradermal. Saan ang site ng administration pag intradermal? Answer. Okay, it should be administered into the dermis just below the epidermis. So ang administration, it should be administered into the dermis. Question, what would be the purpose? Ano yung mga usual purpose? Bakit tayo nag-intradermal injection? Most common purposes is the administration of, okay, for skin testing, allergy test, diba? And aside from skin test, allergy test, your PPD for your tuberculin skin test. Yan yung very common na ginagawa natin. PPD. Dito kasi very common na policy ng facilities dito. Dito kasi bawal na bawal pag may, 'di ba naalala mo, minsan naho-hold ang nurse sa immigration kasi may nakita sa chest x-ray. Naalala niyo 'yon? May narinig na kayo doon, nurse na na-hold sa sa pagpunta sa Amerika, sa US kasi may nakita sa chest. Yun. Very strict sila when it comes to tuberculosis here. Yan. So that's what we call your tuberculin skin test or also known as MAN2. Very good. Meron akong kilala ganyan, hindi na siya nakarating ng US. Kasi nga, magkita dun sa x-ray may scarring, may nodule. Tapos after the treatment, sa x-ray ulit, meron pa rin. Until today, yes. Until today, hindi nila inaalaw. Dapat treated ka with, okay, for tuberculosis before you are able to, okay, kaya may medical exam. That's the purpose of the medical exam. Ganun pala yun, di ba? Sige, so the purposes would be for skin test or for tuberculin, okay, tuberculin skin test or for vaccination. Ayan, sige, very good. Next, let's talk about your, okay, gauge of the needle and the size of, okay, the needle that we will be using. So gauge natin at saka length ng needle. Okay, ilan kaya ang gauge nito? 25 to 27, no? Ang tatandaan sa gauge, palaki nung number, palaki ng value ng number, ibig sabihin yan paliit nung needle. Okay, so yung gauge natin 25 to 27 gauge. And the length, okay, of the needle, very small lang naman yung length niya. 5/8, okay, to 7/8 inch. Ayan, sige. So that's the length of the needle. Volume to be administered. Ilan ang volume na ina-administer natin? 0.1 ml. 0.10, no? 0.1 or 0.10 ml. The larger the number, the smaller the needle. Very good. 25 to 27 gauge. The length 5/8 to 7/8. The volume 0.10 ml. Okay, the usual site of administration, okay, na-discuss natin, dermis, just below, usually on the ventral surface of the forearm. Just, okay, ventral surface of the forearm. Guys, makinig. If we are talking about skin test, okay, we can mark the area with an ink. Mark the area with an ink if that is for the skin test. If it's your PPD, tuberculin skin test, pag nakalagay sa exam na mark it doesn't necessarily mean to put an ink. Naintindihan na? When you say you mark it the area, you just need to take notes saan mo siya in-inject. Pero hindi siya nilalagyan ng ink. Normally, hindi ito nilalagyan ng ink, ha? And usually, ang reading po natin kapag skin test, it should be read after 30 minutes. Diba? Pag tuberculin skin test, nire-read siya after ilan? 48 to 72 hours. We check for the induration. So, ang chine-check mo sa Manto test, the induration. Alright, sige po. So that's all about your intradermal. Questions about intradermal administration? Ala? Learning tayo sa intradermal. Okay, next, let's talk about your subcutaneous administration. Okay, subcutaneous administration, what would be the site? The site is just below the dermis. Okay, on the subcutaneous area, below the dermis. So below the dermis, doon sa fat portion na area. Okay. Now, pag sinabi nating below the dermis, okay, ang pinaka-best site, we could use the abdomen. What else? We could use the buttocks. We could use the thigh. We could use the arms. Ayun. So, ito po yung mga ginagamit natin na sites natin sa subcutaneous. Below the dermis, abdomen, buttocks, thigh, and arms. Okay, very good. Now, okay, what would be the purposes? Ano yung mga ini-inject natin sa subcutaneous? Primarily, insulin. Diba? Ano pa? Okay, heparin or enoxaparin administration. Heparin, enoxaparin administration, very common dito sa enoxaparin, especially dito sa mga post-op, post-knee, post-hip surgery to prevent embolism. Okay, ano pa aside from that? Okay, vaccine. Some vaccines can be administered subcutaneously. Example is your measles vaccine. Yun. So that could be also administered, okay, subcutaneously. Example ha, ng vaccine is measles. Subcu yan. All right, next. Okay, what would be the gauge of the needle? Okay, gauge of the needle that we will be using is 23 to 20, okay, 25. Okay, length of needle to be used, okay, is 3/8 to 5/8 inch. Yan, 3/8 to 5/8 inch. Sige. So, 3/8 to 5/8 inch. Yan po yung ginagamit nating length of needle. The volume to be administered, ilang ml ba ginagamit natin? Ilang ml ang ginagamit natin for the administration? Answer. How many ml? Ilang ml nga? Ito 1 ml, di ba? Pag sub-Q, 1 ml. Usually, units nga lang ang insulin eh. Units lang yan, heparin, di ba? Units lang ang ginagamit dyan, di ba? So, at least 1 ml. Yung 3 ml sa IM yan. Sige, so the volume is 1 ml. Important nursing intervention. Okay, nursing responsibilities. Important nursing intervention, rotate the sites. Bakit? Kasi sub-Q yan, pwedeng mag-develop ng lipodystrophy. So kapag nag-inject sa area ng lipodystrophy, hindi na siya ma-absorb. So that's why you have to rotate the sites. Avoid administering cold insulin or cold solution. So you have to rotate the sites. What else? Okay. Kapag sinabi kong abdomen, kailangan there should be at least, okay, 1 inch distance from the umbilicus region. Pag pinag-usapan ko, ang site ng administration mo, abdomen, usually inject, okay, the solution, okay, at least 1 inch from the umbilicus. So ito yung distance ha. Avoid injecting within 1 inch. Avoid injecting within 1 inch. Dapat dun ka sa after the 1 inch at least from the umbilicus. At least 1 inch. Kasi bakit anong meron sa umbilicus? Sa umbilicus kasi it's rich in what? In your capillary network. Marami yung blood vessel. Baka ma-inject mo siya intravenously. That's the reason why. So inject at least 1 inch from the umbilicus. Now, if, okay, we are talking about your angle of administration. Kalimutan ko yung angle, ano? Kapag yan ay, okay, kapag yan ay intradermal, 10 to 15 degrees. Yan yung angle of administration. Kapag subcutaneous, ang angle ng administration mo usually 45. Okay, 45 degrees. You can also use 90 degrees if your patient is obese or your medications are pre-filled. Ano ba yung mga pre-filled na solution? Yung hindi mo na pine-prepare. Yung pre-filled, nandun na yung needle niya. Example, enoxaparin. So pag nakalagay sa exam mo, enoxaparin, ang sagot mo 90 degrees. O pag nakalagay ay insulin pen injector. O dahil insulin pen injector yan, 90 degrees. Clear? So yung 45 degrees, usually these are for lean patients. Kapag obese at pre-filled ang drug, nandun na yung needle kasama. Usually it should be what? It should be 90 degrees. Another thing na lumalabas sa exam, kapag ang drug na ibibigay ay enoxaparin, okay, tandaan, we do not, okay, remove the bubbles. Kasi usually, pag ano mo yun, pre-filled na siya, inject mo na kagad. Saan ka ba mag-i-inject? Sa sub-Q. Tanong, nagkakos ba ng embolism sa sub-Q? Hindi naman, di ba? Ayun. Meron akong kasama, tinatanggal niya yung bubble na enoxaparin. Ayun, natusok siya, be. Di ba? Sir, enoxaparin, hindi ko alam kung itatapon ko ba. Sa sharp siya, diretso. Kasi may syringe siya. Dito sa amin, basta may sharp, diretso siya sa impervious container, sa non-puncture container. Alright? Safety is your priority kasi meron siyang needle. So remember, inject at least 1 inch from the umbilicus. Kapag enoxaparin yan, okay, at i-administer mo. Remember, it should be pre-filled. So pre-filled siya 90 degrees. Do not remove the bubbles kapag enoxaparin. Okay lang mag-inject kahit may bubbles pa yan, may air yan. Diretso mo ng administration kasi hindi naman ito nagkakos ng embolism. Alright, to prevent injury, syempre. Okay, so that's all about your subcutaneous route. Questions about the subcutaneous route? May tanong? Hala, very clear tayo. Bigyan si sir ng thumbs up sign, intradermal versus subcutaneous. Yes, alright. Guys, bakit ko dinidiscuss to? Sir, very basic naman yan. Nire-remind kita kasi minsan ang nurse ang nakakalimutan yung basic. At ang tatandaan sa actual exam, pag basic ang tanong, bawal kang magkamali. Kasi very basic siya. Ibig sabihin, kailangan must know. It's a critical question. If the question is all about the basic, it is a critical question. Okay, there's no room for you to have an incorrect answer with that kasi the computer will determine that you don't know the basic. So if you don't know the basic, you will not be given an advanced question at all. So clear tayo doon na. Yun yung meron ako mga estudyante, magagaling sila, matatalino, ang gagaling mag-pathophysiology, ang gagaling sa mga select all that apply ng medical surgical. Pero pag ang tanong na basic care, nakalimutan na. Right? And NCLEX is most likely about basic. So majority of your questions will be from the fundamentals of nursing. So that is why we are reviewing the basic concepts. Okay, sige. So para hindi natin makalimutan. Alright, so finally, let's talk about your intramuscular route. Ready na? Okay, thumbs up sign nga kung nandyan pa po kayo, guys. Medyo hinihingal na si sir. Baka dami nang kailangan i-discuss sa pharma, no? Feeling ko nga kulang pa yung 4 sessions natin. Anyway, let's just continue what we can cover. Alright, so let's talk about your IM administration intramuscular. Okay, intramuscular, the usual sites, okay, for intramuscular administration are as follows. Ano ba yung mga most common sites natin? Deltoid. Yan. Ano pa? Vastus lateralis. Yan. Rectus femoris. Yan. Ano pa? Yung mga sites natin ng muscle. Ventrogluteal. Question, do we still use the dorsogluteal? As per reference, as per the book, ha? Not as per practice. Can we still use the dorsogluteal route? Pwede ba yung dorsogluteal? Alam mo yung sa may taas ng puwet? Yung tabado sa may taas ng puwet? No, kasi may nerve doon. Baka pwedeng matamaan yung sciatic nerve. Very good. Pero alam ko doon sa when I was in the UAE, alam ko gumagamit pa rin sila ng dorsogluteal. May mga students ba ako dito from Middle East? Kasi pag Middle East, dorsogluteal pa rin ang ginagamit eh. Pero actually, okay, according to books and references, instead of dorsogluteal, we prefer the dorsogluteal area. Because there is a risk of hitting that major blood vessel and major nerve that can lead to paralysis. Very good. So hindi na natin ginagamit ang dorsogluteal, hindi ko na siya isasama dito. Next, how about if your patient is an infant? According to Pilitary, alin ang pinaka-best? Pilitary and Cushier, sabi nila infant, alin yung muscle na develop na sa infant? That's why you can use that for administration. Very good. You can use the vastus lateralis. At what age can we use the deltoid? At what age can we use the deltoid? Answer, for pediatric administration, we could use the deltoid, toddler at least. Toddler. At least 1-year-old na siya, no? So we can use at a toddler. When is the best time to use the rectus femoris and the ventrogluteal? For rectus femoris, we can also use it during toddlerhood, just like the deltoid. For the ventrogluteal, it starts to be administered during preschool. Ayun. So ulitin ko ha, okay, kapag ang patient daw natin ay infant, vastus lateralis. Pagdating ng toddler, that's the time that we could use the deltoid and the rectus femoris. Ayun, pagdating ng preschool, saka pwedeng start gamitin si ventrogluteal. Alright, sige. So clear tayo dun ha. Okay, next. What else aside from the sites of administration, we have to, okay, purpose. Because it can what? Okay, why we use intramuscular? It can accommodate larger volume. Muscles can accommodate larger volume and okay, it can have a rapid onset of action. So mas mabilis siya. So compared with your oral administration, and it can accommodate large volume. Okay, next. What else? Okay, how about the gauge and the size of the needle? Okay, the gauge of the needle is usually 20 to 23 gauge. Yan. And what would be the length of the needle? Dahil yan ay deep IM. Pag deep IM, ano po ang length ng needle? How many inch po? Pag yan ay deep IM, 1 to 3 inches. Ayan po. Kapag mga deep IM, 1 to 3 inches. Ayun. Right. Next, what else aside from the length of the needle? The volume to be administered. Answer, 3 ml. Guys, paki-highlight ha, 3 ml. If, okay, you were asked about deltoid administration, 1 ml. If it's a deltoid administration, it should only be 1 ml. Alright, now, sir, paano kung ang kailangan ni patient ay 5 ml? So, anong gagawin mo pag 5 ml? Eh di yung isa 2 ml, yung isa 3 ml. Hahatiin mo siya sa dalawa. Yun ang sabi ni Coshier ha. Although sa actual practice talaga nakita mo, di ba? Example, ceftriaxone. Ang patient mo, magbibigay ka ceftriaxone, 1 gram of ceftriaxone. Tapos ilang ml, 10 ml ano? 10 ml or 5 ml, diretso na, no? Sa isang, di ba naalala mo yon? Alright, pero dito, by the book, ang sasagot mo, kailangan at least 3 ml lang. Okay, at the side. So kapag yan ay mas mataas ang volume, hahatiin mo siya. Pag deltoid administration, to be safe, 1 ml only. Sir, nag-aspirate po ba sa IM injection? No, or depende po? I-discuss natin yan. Yung ating procedure. Now, since natanong mo yan, aspiration, we could aspirate for the presence of blood. Depende sa type ng drug na ina-administer. But for the purpose of vaccines, pag vaccines, hindi na nag-aspirate. Usually, di ba, COVID, mayroon pa bang guideline di ba hindi na COVID vaccine? Kapag COVID vaccine, hindi na tayo nag-aspirate usually. Ang aspiration lang natin depende sa type ng drug. Usually naman dito sa US, may instruction yan. Makikita mo yun sa MART, sa kalagay doon, aspirate first before injecting, noting for blood. Ganon. May ganon sila. Okay. Sir, saan po belong yung Z-track technique? Okay, that's a good question. Z-track administration, okay, is part of administration if the solution is considered as irritant. So, pag mga medication tayo na irritant, na bawal siyang mag-leak sa subcutaneous tissue kasi pwede niyang ma-damage yung subcutaneous tissue. So, kapag irritant or vesicant siya. Number 2, it can cause staining. Very good. It can cause discoloration of the tissue or of the skin. So, example, iron. Ayun. So, doon natin ina-apply si Z-track. Ay, di-discuss natin yung Z-track na yan kasi lumabas yan sa exam eh. May tanong pa dito. Sir, EpiPen for toddler po. Kayla, anong tanong mo about EpiPen for toddler? Saan ang administration? Okay, ano pa rin tayo? Thigh. Thigh is the best site for EpiPen administration. Thigh is the best site. O kahit pa hindi mo natatanggalin yung damit dun sa thigh, diretso dahil emergency siya, anaphylaxis siya, EpiPen siya, kahit nakapan si baby or si patient, okay, kailangan inject ka na diretso dun. Alright, sige po. So again, the length of the needle is 1 to 3 inches, volume at least 3 ml. And what would be the angle of administration? It should be perpendicular. It should be perpendicular 90 degrees. Ayan. So the angle of administration for IM, 90 degrees. Very good. Okay, situation. Punta tayo sa mga situations natin, ano? Alright. Okay, remember, nursing intervention, aspirate. Di ba sabi ko aspirate? Depende sa drug. Kapag COVID vaccine, hindi ina-aspirate. Pero kapag ibang klase ng drug, we can aspirate to check for blood before administration. Example, pag aspirate mo may blood, what should you do? What should you do with blood? Anong gagawin mo? Answer, you have to discard. Okay, you have to discard. Pag may blood siya, discard and then get a new what? A new set of medications. If with blood, discard and administer using, okay, new set. Okay, of medications. Okay, so wag mo na siyang i-reuse ha kapag may blood ha. So kapag walang blood, okay, if without blood, you can continue to administer. But if it's with blood, discard, administer using new set of medications. Clear? Okay, sige. Next. What else? Okay, how about there is persistent pain? Okay, nakita mo, no? Persistent pain during administration. What should you do? What should you do if there is persistent pain during administration? Stop. Okay, pag may persistent pain, you have to stop. Okay. Huwag mo i-continue, ha? Kulang pa ba yung sakit? Dagdagan mo pa yung sakit? Eh, hindi. Diba? Okay, so definitely you have to stop. Okay, whenever there is persistent pain. All right, now, your question is all about Z-track administration. Okay, now, punta tayo kay Z-track. Lumalabas ba sa exam? Yes, Z-track IM, sabi ko nga, if the solution are considered irritants or can cause staining. Alright, now anong lumalabas po sa actual question? The procedure. Place the correct order in sequence, drag and drop. Ayan na naman, ano? Drag and drop na naman tayo. Very basic. Anong gagawin mo muna? Kauna-unahan for Z-track administration, number 1, displace the skin. You have to make the skin taut as much as possible. I-displace mo siya, no? Alright, so para kapag pag ni-release mo siya, naka-seal off na yung drug. So you have first to displace the skin, next, inject. Okay, followed by, after you inject the medication, you have to stabilize while you are injecting. So usually you inject using dominant hand. You stabilize using non-dominant hand. Okay, sige. Next, number 4. After you stabilize, what's the next thing that you have to do? Wait for 10 seconds. Wait for 10 seconds. After you wait for 10 seconds, what should you do? You have to remove the needle. Withdraw. Okay, withdraw. Okay, the syringe and needle. And then after you withdraw the syringe and needle, that's the time that you can release the skin. Ayan. So ito po yung ating pagkakasunod-sunod sa procedure. Place the correct order in sequence, drag and drop. Ewan ko na lang talaga kung hindi nyo pa makuha yung tamang sagot dyan. Pinakain na ni Sir lahat ng mga lumalabas sa exam, ano? Andyan na siya, no? Alright, so that's all about your IM administrations. Questions? May tanong tayo kay IM. Wala na. Very clear tayo. Alright, so those are the routes of administrations. Clear na clear. None so far. So far, so good. Ayan, sige po. So those are the important interventions when you are administering parenteral administration. Sige, balik natin sa slide ha. Sir, pa-screenshot daw. Sige, screenshot nyo na muna. Ayan. Ayan. So thank you so much, guys. Ayan. So I believe that I have discussed the basic concept, introduction to pharmacology and your basic principles of administration. So ano po yung mga naiwan natin na topic? Hindi pa tayo tapos ha. Okay, tingnan lang natin ano pa yung mga naiwan natin. Sir, ang bilis ng oras pag ikaw nagturo. Ang dami kasi, no? Ang bilis talaga ng oras. Hindi na natin namalayan, 10 o'clock na. Ayan. Sige, so ito yung mga topics na naiwan natin. So for tomorrow, we will continue with developmental consideration. I-discuss na natin, ano? Padaanan na natin. Sorry, meron pa akong 5 minutes. Now, for developmental consideration, okay, be sure to prevent aspiration when you are administering in a child. So kapag siya ay baby, at the side of the cheek. You can administer it at the side of the cheek using your plastic syringes. Ano po? What else? Developmental consideration. Usually, it is not of good taste. You have to improve the taste of the medication. So kung yan ay toddler, preschool, ayaw niya ng gamot kasi hindi masarap. So anong gagawin mo? You have to give them ice chips or popsicles prior to administration. So bigyan mo sila ng popsicles tsaka ng ice chips kasi it can numb the taste buds, then it can make them easier to take the medication kasi nakaka-numb siya ng taste buds. So to numb the taste buds, anong health teaching mo kay mami? Pwedeng mag-start muna tayo, ice chips and popsicles. Prevent aspiration, at the same time, improve the taste. Ayun, ang diniscuss ko ha. Okay, prevent aspiration, improve the taste of the medication. Next, what else aside from improving the taste? Ano pa po ang mahalaga na lumalabas sa exam about pediatric administration? Ano nga yung diniscuss ko? Preventing aspiration and improving the taste. May nakalimutan pa ako dyan. Pediatric administration. What else? Okay. How about the administration of or mixing of the medication into the baby's milk? Ayun. Paano daw? Can we mix the drug in the baby's milk? What do you think? Mamaya ko sagutin yung mga tanong nyo ha. Alright. Okay, question. Can we mix it with milk daw po? Pwede daw po ba? No. Bawal i-mix sa milk ha. Bakit? Principle. Kasi si baby, pwedeng hindi maubos ang milk. Very good risk. Pag hindi niya naubos ang milk, hindi accurate ang administration. Very good. Next, don't tell the child that medications are referring to candies. Very good. May nagsagot nun sa akin kanina. Don't tell them that it's candy. Very good. That's another important rationale. Kasi kapag sinabi mong candy, vitamins pala yan, ano ang danger na meron sa multivitamins? Ano ang danger na meron sa multivitamins? The mineral iron. O, tatandaan nyo na, the mineral iron. Iron can be found in multivitamins. Alam mo yung mga gummy bears? Nung time kasi namin, ang uso sa amin, Flintstone eh. Di ba, Mama Edna? Ma'am Edna, kabatch namin yan eh, di ba, Ma'am Edna? O yan, sige. So, di ba, Flintstones? Ay, si Kyla, alam yung Flintstones, di ba? Ay, sorry po. Sorry, nagpipinpoint na si Sir ng mga ka-age ko. Di ba? Ay, di ba, Ma'am Edna, uso sa atin yung yun, bawal mo yung kainin. Kasi pag sinabi mong candy, baka kainin ng kainin ng bata yun. So do not what, okay, do not tell. And then you have to, okay, provide safety when administering, okay, medications. Kailangan it should be out of reach. Children, okay, should not be able to reach. Kailangan nasa locked cabinet o kaya naman child-proof bottle. Yes. Kailangan ilagay mo siya, wag mo ilagay sa ref kasi baka kunin ng bata yan, hindi tinira niyan yung gummy bears, 'di ba? Kala niya candy. So you have to place it on a locked cabinet or you should what? You should place it on a child-proof bottle. Ayun. Okay, now for expired medication, for safety purpose, what should you do? Okay, home consideration. Usually dito sa amin, merong ano yung pharmacy on how to discard eh. Meron silang binibigay na solution. Pero usually pag home, okay, home management, advice mo sa patient, flush it. Very good. I-flush natin sa toilet yan kasi ano naman na siya. Huwag basta-bastang i-discard sa basurahan kasi nandun pa rin yung tabletas eh. Right? Okay, so immediately, you need to flush it. Very good, Kyla. Flush it. Okay? Sige, so clear tayo dun ha. Very good. May mga questions ako dito. Okay, sabi nila, Sir, paano pag may cleft palate? Paano bibigyan ng meds after surgery? That's a very good question. Kapag mga cleft palate naman, cleft lip, cleft palate, usually ang binibigay natin cup, paper cup, 'di ba? That to prevent tension on the suture. Kasi hindi pwede yung empty nipple eh. Kasi kapag empty nipple, isasak niya 'yon. While sucking that, it can cause tension on the palate and on the lip, on the repaired one. So dapat ang gagamitin mo paper cup. Ayun. Clear tayo doon, ano? Sir, pwede rin po ba yung specialized bottle for feeding? Specialized bottle for feeding, the crosscut nipple. Naalala mo? Crosscut nipple, specialized bottle feeding. Okay, so pwede yon. It's either a paper cup or the specialized bottle, the crosscut. Very good for feeding. Ayun, sabi nila, Sir, ang bilis po ng oras pag ikaw nagturo. Ayan, sige po. Hindi ko nabasahin yung ano niya, comment niya. Yung unang comment. Not for favoritism, pero blank, blank, blank. Mas naintindihan po namin yung topic, honestly. Oy, thank you po. Love lots. Thank you a lot, sir. Ayan, thank you din po. Thank you for listening. Okay, medyo spontaneous ako pag nagtuturo ng pharma kasi ang haba ng topic natin, ano? Very spontaneous tayo kasi talagang madami tayong i-cover. Yan. So thank you so much po for listening and for attending session. So ano yung naiwan natin? Just for an announcement, naiwan natin dosage and calculation. Okay, naiwan natin si IV therapy. Naiwan din natin yun na dosage calculation, IV therapy, what are the complications related to IV therapy, and then also your central line and the peak line. How to care for a patient with central line, peak line. Okay, so yun yung mga naiwan natin na mga i-discuss natin for Pharma 1. I think kayang-kaya naman yan for the next session before we have our post-test. And then, next week, okay, that's the schedule of our clinical pharma. Ayan, sige po. So, basic muna tayo until tomorrow. So, I'll see you again tomorrow. Naiwan na niya ako. Sir, yung 4 years ko, sir, sa college, ginawa mong 4 hours sa pharma. Ay, salamat po. Yung 1 sem tapos stress na yung grade mo. Naging 4 hours lang na-tackle lahat. Yun yung kagandahan kasi dito sa NCLEX. Okay, very direct to the point tayo when it comes to most common topics that is appearing in the questions. Ayan, sige po. So I hope maraming natutunan po, okay, on our discussion. So it's already 10 a.m. here in my time. May coaching pa po ako mamayang 1 p.m. dito. Tapos meron, kailangan lang mag-sleep kasi 10 p.m. na dyan. So I'd like to thank everybody for choosing Top Rank Review Academy. Here in Top Rank, we believe that top results require top ambition. Alright, sige po. So I'll see you again tomorrow for our next session of pharmacology. Bye guys! See you again tomorrow. Bye po.
Bye-bye, sir. Thank you so much, nurses. Bye-bye, sir, Gem. Thank you so much po. Ingat po kayo dyan.
So correct answer, you better A because it doesn't
Baby, ba't ka tumatawa? Buisit ka.
Okay, there-
Alam Alam kung bakit ka
Yes, sir.
tumatawa. PM mo ako.
Bye-bye, sir. Bye-bye po. Good night po.
Fish,